Okay, being 9:30, we could start. There's a chair and vice chair meeting going on and also a ranking Democrat meeting going on. So, um, that's why the chair's not here. Him and I are going to be switching off. So we'll start with the Bureau of Child Support. Good morning.
I am the Bureau Chief and Title 4D Director for the state of New Hampshire Child Support Services with the Department of Health and Human Services. I do have a handout for you. Would you like me to hand out
Just hand it to Representative Bickford. You just slide them all down.
Want to pass it down?
Sure.
Thank you.
We could have.
Yes. So this is, thank you. Thank you for the opportunity to have us here today to introduce ourselves to you. And accompanying me today is Matthew Cade, who is our legislative liaison, whom some of you have already met. I have had the honor in serving in this role for the Bureau of Child Support Services for over a year now. And just to provide you all in the committee with just a little bit of background about who I am, I come into this role with 22 years experience working here in the state of New Hampshire for the Department of Health and Human Services. I have had the privilege and opportunity to work for the Division of Children, Youth, and Families prior to joining the Bureau of Child Support Services about 9 years ago. And throughout my career here at the Child Support Program, I've held a variety of different positions, both within our management and our field operations. So the information that we have prepared for you today is to really provide you with a general overview of the child support program, to really speak to who we are and what we do and the customer population that we are servicing here. I understand that our time here today is limited. So my hope is to take just about 15 minutes of your time to provide you with some information and certainly allow for any questions that the committee may have of us. But really want to be able to leave you with information as a resource to you moving forward through this session. And if we can be of any help or support or answer any questions, certainly we will be here and available to you all. Our contact information and my business card is available in the presentation that I've prepared. I don't plan to go over every slide with you, but certainly the information that I will share with you should complement the information in our slide. So to start, I just wanted to share a little bit about our organizational structure. The Bureau of Child Support Services lies within the Department of Health and Human Services, and we sit within the Division of Economic and Housing Stability. And our program is responsible for administering the Title 4D program for the state of New Hampshire, which every state is required to have a child support program consistent with the Social Security Act. And our program is, the child support program in general, is one of the largest income support and anti-poverty programs for families in government agencies. And our specific child support program provides statewide services in 11 offices with our administration. We have a central information unit as well as a central intergovernmental unit. Oh, thank you. So So it's really the mission of the Bureau of Child Support Services to encourage responsible parenting and family self-sufficiency and child well-being. And we do this by providing our core services to our families, and that's with locating parents, establishing paternity or legal fatherhood, modifying, enforcing child support obligations, and obtaining child and medical support for children. So we really believe that it's the responsibility of parents to financially support their children. And we aim to provide quality service to helping parents through challenging circumstances concerning child support. One of our primary roles is to help families navigate child support, which can be at times complex. And so we find a lot of our work around educating our parents and our families and trying to connect them with the correct means of services within the community and to be able to provide the best outcomes for children and families. So as I mentioned, the child support, every state is required by our federal government to have a child support program and to implement a state plan to provide those services. And really the child support program was created to ensure that children in single parent family households received a reliable source of private financial and medical support. The child support program really serves, all families from all socioeconomic backgrounds. And in our federal fiscal year of 2021 here in New Hampshire, our child support program served about 33,650 children and families. So our Federal Office of Child Support Administration really oversees the child support program and provides a tremendous amount of supports to our states to help us develop, manage, and operate our program according to our federal laws. And the child support program has really evolved over the years to become more flexible, more efficient, more modernized. And our federal government has issued rulings to help support the states in being able to provide that flexibility to families. Families have differences in structures and supports and needs. And so the child support programs recognize the need to be able to be flexible and to modernize and to keep up with the changes and the challenges that families are facing today. So, in New Hampshire, our child support program is working to be able to fulfill those needs for our families here. And just to note that, our program is, we collect and distribute private and not government funds to families, so to help them pay and support their children and meet the basic needs. Our services are provided to families whose parents or caretakers don't reside in the household, and so we spend time trying to ensure that families are aware of the importance of, positive co-parenting, working together as a family for the benefit and the well-being of the children. Part of our role is to ensure that those parents who are unwilling to pay child support, who are obligated to do so, that we work to try to compel them to pay and provide that support. We certainly have a number of tools available to us to assist the program in doing so. And sometimes there are circumstances where parents are willing but unable to. And so there may be a barrier that is interfering with their ability to pay. So the program really focuses on trying to identify what those barriers are to help reduce those and provide any services or referrals to area agencies or services within the communities to help families reduce some of those barriers. So the program is really has to be pretty equipped with understanding what services are available to families to help them to overcome some of those challenges. Certainly, we do run into circumstances where parents are just unwilling but are able. And in those circumstances, we do have enforcement authorities that assist us in being able to compel them to comply with their child support order. So the child support program also services and helps to reduce families' needs to rely on or need public assistance whenever possible, certainly in circumstances where families are in need of temporary public assistance through any of our benefit programs that child support is a requirement of their eligibility. And so we will work with them and assist them with obtaining child support orders and assisting to offset some of the costs that the state may incur as a result of that through their child support orders. I think it's important to also note, and sometimes that in order for an individual to receive our services through the Bureau of Child Support, that they do in fact have to apply for our services. So even with a court-ordered obligation that may be payable through the Bureau of Child Support Services, our program does require an application process. And we have opportunities for folks to access information and resources that are available to them out on our website to help guide them in accessing the services that we might be able to provide. We do also provide services to parents that live across state borders in tribal communities and internationally. So we're not, we try to provide services on a global basis. So I would like to just highlight a little bit of some of the core functions that the program provides. One of the services we offers is we locate parents. So parents who are outside of the single family household, if they need assistance, we can use a variety of systems that we interface with to try to locate parents so that they can become involved in their child's life, and or we can work to establish paternity or legal fatherhood in circumstances where that may be needed. And that is, again, one of the core services that we provide. We also work with our families to establish the child support orders and medical support orders here in New Hampshire. All of that is done in collaboration with our New Hampshire Circuit Family Division. Since here in New Hampshire we use a judicial process, the court is really a good collaborator with the Bureau, and we work very closely with our court partners. And as I mentioned, we enforce child support and medical support orders. And again, it's really the responsibility of the parent that's obligated to pay to be able to comply with that. And we really see that it's our role and responsibility when we're working with families to ensure that they have the means to be able to do so. And if they are unable to do so, then we can act on some of the enforcement authorities that we have available to us, such as, a recreational professional license revocation, liens, an income withholding order for wage garnishments and payments. And if needed and necessary, we can certainly utilize the court to assist us in ensuring that an obligor or a person responsible to pay support is able to do so through those means. I think what's important to note here is that the Bureau really tries to take a progressive approach to engaging our obligor or obligated population to pay. We really try to engage with our customers to comply. And as I mentioned previously, to really be able to identify what those barriers might be and make sure they have the resources to access those, to be able to alleviate those barriers so they can be in compliance and provide them with the choices that they need to be able to be successful for the benefit of their children. And of course, our program collects and disperses child support payments. we have a sophisticated child support system, automated system that interfaces with a variety of different state and federal partners that allows us to be able to collect and distribute and keep accurate records of our payments for our families. And here in New Hampshire, as in many and all states, we have a state disbursement unit where all of those payments are collected and dispersed from. And we have a provision in place where all payments are required to be distributed and dispersed within 48 hours to our families. So in addition to the court being a stakeholder that the Bureau works with, certainly our employer community is also a big stakeholder for the Bureau of Child Support Services, where we want to work really closely with our employers here. In New Hampshire, specifically in our last federal fiscal year of 2021, 71% of our collections that we collect are from income withholding orders. So it's really important that our program continue to work closely with our employer community. And we also, of course, as I mentioned, collaborate with many other state department agencies as well as other non-governmental agencies as well to help with our daily operations. You know, the child support program, as I mentioned, has been transforming, and we're really promoting a real family-centered approach to strengthen parents' abilities to become more self-sufficient and to be able to support and care for their children, try to reduce any stressors that may be impacting. But really, you know, at the core and the heart of it, our role is to really ensure that the child and medical support obligations that are ordered here in New Hampshire are being fulfilled and are being provided to the children and families. We do work with a number of outreach groups and individuals to help promote the services that we offer, because we recognize that families have a number of challenges in raising children today. So we really want to be able to provide assistance to both families, both parents, excuse me, and really assist them through navigating the child support process wherever we can. So we have a very dedicated and competent and professional workforce, and you know, really, as I mentioned, just here to be a resource to all of you and to the families that we serve. And we want to be able to, you know, help our community understand whatever we can to assist them in educating them in relation to the child support program, as that also extends an offer to all of you. So understanding that our time is limited, that is just a basic overview and a general overview of the child support program. Certainly, Attorney Hayes and I are available to answer any questions that the committee may have of us, should you have any.
Thank you very much. Are there any questions? Representative McMahon?
Thank you, Mr. Chairman. If I, just clarification on, appreciate the data you provided. When it says 71% from the parent's check, one of the parents, is that first a court order before garnishment can be implied or done?
That is, so the 71% collections of income wage garnishment, thank you for your question, is in relation to our total number of collections through the federal fiscal year of 2021. Any orders that we were collecting on and or enforcing on were collected by an income withholding order, which is part of our child support orders here in New Hampshire.
And the follow-up, just two things is just your guidance, both of you, on the timeline once there's an application to the court, and how long does it take to facilitate it when you have a need like tomorrow, for the family. But also is, when it's 29% from other sources, what are the other sources to make up after 71%, that difference?
Thank you for your questions. And if I understand what your questions are, so the first question is the timeline from when our program receives an order for child support services to enforce from an income and try to implement an income withholding order if one is available. Again, I think it depends upon the timing. We try to by way of practice, enter orders as quickly as possible onto the system. It could be up to a couple of weeks before our staff can process those orders and get them up. Once we're able to issue an income withholding order, it's up to the employer to be able to process that income withholding order. What we try to tell our families is to be patient with their employer, and that it could potentially take up to 4 weeks before they could get that income withholding order set up on their payroll if they have, or if they're working with a payroll provider. But we certainly encourage our paying parents to reach out to their employer to inform them that an income withholding order may be forthcoming. And then our program will follow up within a 30-day time frame to see if if payments haven't been received. So we'll try to monitor to make sure that payments are received timely. And to answer your second question in relation to what the other sources of, so that might be sources from unemployment, that may be sources from self-payors. It may be sources of employment from any liens or lottery intercepts. It may also include payments from our federal offset program.
Thank you.
You're welcome.
Any further questions? Representative Bickford.
Chairman, child support study is Health and Human Services is required to do a child support study every 4 years. Can you get us the last one, or do you know when the last one was?
Thank you, Representative Bickford. Yes, actually, our program just completed a review of the child support guidelines of this past month that is published and is currently out on our website, but I would be happy to provide a copy of that to the committee.
Follow up? Not only would I like to see that, I would like to see the last time the legislative study committee was done. We used to do it legislatively, and then we allowed Health and Human Services to do it on their own if the legislative one didn't get done. And then just one other follow-up. On page, give you a chance to write, on your pages with the after page 8, so I guess it's page 9, it shows near the bottom there that New Hampshire spends $1 for every $3.15 collected, and yet you go to the next page, it shows nationally $1 spent, and they collect $5.27. So it's like, wow, that's kind of a large disparity. Why does it cost so much in New Hampshire to chase after money? If you happen to know.
Thank you for your questions. So the cost of for every dollar that is spent on the child support program here in New Hampshire, based on our cost effectiveness ratio, collects $3.15. And then nationally for federal fiscal year, as you correctly noted, was for every dollar spent on the national program throughout, that's $5.27, which is certainly there is a formula behind the cost effectiveness ratio here in New Hampshire that I could certainly provide more information to you on if that's something that the committee would like to do.
It just looks like we're not doing that well compared to the rest of the nation So I'll leave you with that. And if you can give me any information, I'd appreciate it. Thank you.
Thank you.
Any further questions, Representative Raymond?
Thank you, Chairman, and thank you so much for coming this morning. I'm curious about timing of the collecting of child support payments and the distribution of those payments to the other parent. So we've been talking in this committee about the potential of having a date, like on the 1st or the 15th of the month, that child support payments would be collected and then dispersed. How does that work now? Is there, like, does everyone getting child support payments get them on the 1st of the month? Or is it dependent upon the employer, whoever's employed, when they get paid? Or is there some other mechanism by which the payments are dispersed on a regular basis?
As soon as the payment is received, thank you for your question. As soon as the payment is received, we disperse those payments out to the other, to the parent receiving it within 48 hours.
Okay.
So it all depends on when the payments are received by the program.
Okay. Thank you.
Yes.
Further questions? I have a couple. You'd mentioned child support and medical. Okay, so my first question is, you receive payments from those that are just garnished? I know there are some parents that are paying directly to their spouses, to the payee. Is your payments are just by garnish, or do some parents send a check into you other than an employee?
Thank you for the question. Yes, we receive payments from, so we receive and collect payments from individuals who apply for our services in the first instance. Not all families apply for our services. So the ones that, the families that do, we collect and receive payments in all sorts of manners, either through income withholding, they can pay by check, they can pay through money order, through MoneyGram. Through our contracted state disbursement unit, we have an option for electronic fund transfers so that they can do direct payments through their banking institution. There are multiple ways that families can pay for their support, not just by an income withholding order, although that is the preferred and ordered way if it is available.
Great. And my other question is, with respect to medical, is it just those that are in your system? It's those that are both child support and you also review their medical?
Yes.
So it's not, if I'm not required to pay child support, but as a medical, would you be involved in that medical, or is it just because of the child support?
Thank you for your question, Representative Long. And if I could just clarify, so in the state of New Hampshire, we have our uniform support order process requires that both a child support, a financial obligation, if it's applicable, and a medical support provision of parents' responsibility to provide health care coverage to their dependent. If the agency, if the Bureau is collecting and enforcing on that child support order because a family has applied for our services, we will look to enforce both child support and healthcare coverage provisions. Healthcare coverage in New Hampshire can be provided in a multiple of ways. It can be through satisfied through public health insurance, through, for example, Medicaid, and or through private health insurance. So if we have a obligated parent who is required to provide health insurance to their dependent, and let's say perhaps their employer provides health insurance as a option for employment, and that health insurance is covered under the amount that the person responsible to pay is reasonable cost here in New Hampshire, then we will work to the employer to get that dependent enrolled in that health care coverage. So we try to ensure that both the child support and the health care coverage are covered.
Great. Thank you. Any
Thank you.
further questions? Representative Grossman?
Hi, thanks for coming. Sorry I missed your presentation. I was in another meeting. I have a question. Somebody recently asked me, when you have a situation, does child support always end at 18? And the situation that someone came to me, when you have a child that you gain guardianship of because of a disability after 18, where does that, are there any child support, like the medical after 18, if you have guardianship or if there's a adult child with a disability? So like meaning you have lifelong care of that dependent, there's a divorce, does it end at 18, I guess? Somebody just recently reached out about two dependents that's the situation.
Sure. Thank you, Representative, for that question. I think that there's kind of two parts in your question there, and I don't know that I would be ultimately informed to be able to answer that question for you properly, because what I'm hearing you ask about is, does child support end at 18, or the provision for health insurance coverage in a child support end at 18? And then there's a second half of that, which it sounds like continuing health care coverage after somebody turns 18. Again, the piece that I could really speak to is that, you know, we enforce orders, both health insurance and child support, through high school graduation or age 18, whichever comes last. And unless the court order specifically states differently. So I would not, to be able to answer your second question, I would need to reach out to some of my colleagues in the department to better answer that.
Thank you.
Any further questions? Seeing none? Thank you very much.
Thank you.
So I believe the behavioral health is Ms. Ross? Awesome.
Sorry about that. Good morning. For the record, I'm Rebecca Ross, the Director of the Bureau for Children's Behavioral Health, which is within the Division of Behavioral Health at Health and Human Services. I see a bunch of familiar faces and a whole bunch of new ones. So I have tried to put together a presentation that gives some background, current state, and next steps. I will try my best not to use acronyms or nicknames in a way that I lose people quickly. I do get excited about what we do and talking about it, so please stop me if I slip one in and you'd like an explanation. I have tried to leave them out of the
You get a
presentation.
gimme on DHHS.
Oh boy, I could be here a long time. No, thank you, Representative Pearson, but please do stop me because we have been moving fast over the last few years. Does everyone have the presentations now? Okay, great. So I believe I have a half an hour. I will try to do my best to stay on that. The first slide after the cover page is just a representation of our org chart showing that our division is under the same associate commissioner as the Division for Children, Youth, and Families. And until very recently, we really didn't have a distinct Bureau for Children's Behavioral Health. There was a lack of access across the board, and particularly for high intensity voluntary services. which could only be accessed in DCYF cases through a court order. So when we were created, we were put within the Division of Behavioral Health Services, but under the same leadership as DCYF. So we continue to work closely with DCYF to serve their population as well as individuals that are not court involved that need access to treatment. Going on to the second slide, I work in the Bureau for Children's Behavioral Health. We're broken up into 3 units. Our system of care, which many of you have seen and heard about over the last few years, is made up of 5 tiers. Our bureau is broken up into 3 bureaus, and 1, 2, and 5 are within the system of care administration. We also have intensive community-based services, and the 3rd bureau is the residential treatment services. And so we'll explain what those tiers are and what's included in them in the next few slides. But that's how we've organized the work that we have. And we have a total of 9 people supporting the work throughout the state and really driving the work that started in 2016 with the first statutory reference to a children's system of care. The community and state work started a little bit before that, but in the 2016 session, the first version of RSA 135F was adopted, which is the Children's System of Care law. It charges both the Department of Education and the Department of Health and Human Services with creating an integrated system of care. And you'll see that they've developed a comprehensive plan for improving effectiveness, efficiency, and integration of children's behavioral health services. And we take that mandate extremely seriously, that in everything we build, we're trying to eliminate those silos, figure out how people are going to access them, how people are going to know about them, and how they are going to work together to serve the children, youth with their families. In 2019, the Senate Bill 14 was adopted, and it not only amended RSA 135F, but RSA 170G, which is Children's Services, which historically was only DCYF services. This law change expanded it to really be encompassing of all children accessing behavioral health services. So we continue to certify those providers under that statute, but they're not exclusively for DCYF involved families. Additionally, the public assistance statute was amended to include the mandates to create a benefit for our high fidelity wraparound through a Medicaid state plan amendment and create mobile crisis statewide for children. And we have incorporated that into statewide rapid response, and we'll talk a little bit more about that, but that was one of the major drivers when we built the rapid response system. The statutory framework includes the values for the system, which are that services are family and youth driven, community-based, culturally and linguistically competent, and trauma-informed was added in 2019. And we incorporate that into everything we do. It's incorporated as a requirement in all of the contracts with providers, consultants, and other individuals that we work with to ensure that we have that consistency and integration across every tier and every type of service that is publicly funded. So what does a system of care include? Going back to 135F, it's not just children's behavioral health. It's not just DCYF involved youth, but it's children with disabilities, the special education statute, services under 135C, which is the traditional mental health statute, early intervention, including our Child Development Bureau, for example, and the Child Care Scholarship Program and early supports and services. So essentially anywhere, starting from that very early assessment and contact with families, the services that we are supporting for families should be consistent with those system of care values and built and improved in an integrated way. The framework requires us to have a uniform or universal assessment in those contracts, we've selected the CANS. So that is the Child and Adolescent Needs and Strengths tool. Historically, it was done at the community mental health centers, which are a tier 2 service. And we have included it in our residential programming, our contract with the operators of Hampstead Hospital, the DCYF child protection workers, and juvenile probation and parole officers have been trained. So now we have information on strengths and needs of children throughout the system that we can look at how they are improving or not, as well as how providers are performing over time. It's going to be a lot of work to refine those data systems to make sure that we're best using that information, which is a goal of ours. But for the first time, we can really start to look at measurable data on how we're doing and how healthy our children and families are. So I will use CANS going forward, but I've defined it, and I think that it'll make sense in the future context, but that's becoming a very universal term for our system, including as individuals are looking for what level of care, asking what did the CANS identify, what are their strengths, what are their needs, how can we lean on their strengths, and what do we need to do to meet their needs. And all of our providers are starting to talk in that same language. There are some additional drivers of the system of care work that we're doing beyond just the system of care laws in New Hampshire. We also have the 10-year mental health plan, which in 2019, it was the first plan that included children and youth. The juvenile justice transformation work that requires an assessment, which is a modified version of the CANS, prior to law enforcement or prosecutors filing a petition for delinquency in court to determine whether or not community supports are more appropriate and available, and connect youth before they're ever court involved. Because we know that once they are court involved, it is much harder to step back from that court system. And if we can get them before that, we have much better success of never getting to court or staying court involved throughout their minority. I have included a little bit more of an explanation of those, as well as the Family First Prevention Services Act, which is the federal act that was adopted in 2018 that really changed the way Title IV foster care funds follow the services, supporting prevention for the first time, and putting some guardrails on the use of residential placements to require them to be treatment.
Could I ask you to call out either the slide number, which is in 4-point type, or better, the page number in the lower right-hand corner?
Yes.
Because I fear we're on different pages.
Okay,
Thank you.
yes, I am on the bottom of page 5. And when I realized that my presentation was so long, I chose not to do full-size slides. I am happy to email them because you can see it a lot better, particularly the data and not just the slide numbers. So I will stick with page numbers to help guide us. So we've also come up with a new graphic to really show the big picture. So at the top of page 6, and you cannot read all the tiny little things in the blue boxes, but we will be explaining and walking through those, and I'll get to the electronic version. But essentially, we've created a graphic that is a circle with child and family in the center, and the 5 tiers wrapped around with rapid response on the outside of all of that, because it can support any level of care. These are not rigid tiers. People will move in and out of systems. Some providers will primarily fit in one bucket, but maybe serving kids in multiple tiers. It's more of a framework and a concept of how we start and move through the system supporting children and families. So starting at the lowest level, including every child and youth with assessment, screening, and treatment, moving on to community-based services, which would include outpatient counseling, community mental health centers, to the intensive care management services, tier 4, our residential system, and tier 5, our acute system. So Originally, when we looked at this, it was the acute psychiatric care hospitalization, but we recognize that we need to ensure that the emergency departments as well as rapid response are really included in one tier. And so because rapid response can serve at any stage or any phase of a crisis, including up to tier 5, we've included it in tier 5 for discussion. And we know that the emergency departments in our hospitals are doing a lot of work to stabilize and support children and family as they move between the necessary services. So moving on to the bottom of page 6, tier 1, that assessment, screening, and treatment is intended to be the services accessed by all children. All children are going to school or childcare or their pediatrician. Are we doing those screenings and assessments and sending them and referring to the appropriate services if needs are identified? Tier 2, looking at those community-based services, including our federally qualified health centers, some DCYF specific services, but primarily our community mental health centers, which prior to the system of care were really the only place besides private counseling or hospitalization for children and families to go if they were not involved with DCYF. The bottom of page 7 shows some of the increase or overall growth in the community mental health centers. So the bottom red line is that trend line over the last few years for youth. And you can see that both youth and adults have seen a substantial increase. And we know that there are still capacity issues in community-based services, but we also know that capacity has been growing, and it doesn't feel like that for the children and families who are on a wait list, who still have needs and who can't get them met immediately. But we do also have the data that supports that we are expanding access for that population, as well as the adult population. It's just not keeping up with the needs that have grown over the last few years. The intensive community-based services, also driven from RSA 135F, started out with what was known as and still is known as Fast Forward. It's New Hampshire's high fidelity wraparound. It is an evidence-based practice, and we have expanded greatly over the last few years when we provide that service as a Medicaid benefit through a state plan amendment. We have to renew that every 5 years. The first time we submitted it 5 years ago, our projection was that we would be serving approximately 150 families a year. We are well over 500 at this point, combined with our tech services that we'll talk about, but well over 400 at any point in time, which was not anticipated and is a huge impact on staffing for the agencies that are providing those services, our peer support agencies that are part of that model, and essentially everyone else that's connected to it. Serving those families is a high intensity service with a lot of contact that takes a lot of the workforce, and we're very excited about the number of families being served. That means they're not moving into residential or sitting in our emergency departments or being hospitalized, but it does mean that we need more and more workforce every day. So in addition to Fast Forward, we have added TREC, which is Transitional Residential Enhanced Care Coordination, built on the same model, serving individuals in residential care or psychiatric care, including at SYSC, to transition them safely back into the community. And then most recently, we have added the early childhood component, which is the 0 to 5 population, and based on exposure to ACEs as well as a child's diagnosis. So really supporting the caregiver and looking at the environment the child has been exposed to meet their needs before we see them later on in their childhood and adolescence. The care management entities are specifically, we have 2 contracted entities in New Hampshire. They are conflict free. So they are intended to be able to assess and identify those needs and connect families with those services without referring to themselves. And they are looking, the goals of using the care management entities are to improve the clinical outcomes, enhance efficiencies and control costs, and foster resiliency in the families and youth that we serve. And on the first 5 years and our pilot, the data has been very supportive of those fast forward services. And we're starting to look at that data as we're building into TREC and the 0 to 5 models. The components include the
Page number, please.
thank you. Page 9, the top slide. So for all of the services, there's some form of enhanced care coordination, family and youth peer support. Obviously, the 0 to 5 model is modified that, you know, they're not receiving youth peer support, and the peer support is focused on the caregiver. Customizable goods and services, and the care management entities have responsibility through their contracts to also help develop that provider network through training, through identifying the best practices and collecting data on the services used and the outcomes. So they really are partners in continuing to measure the system and expanding the services, because the care management entity and the care coordination isn't the clinical service, and they're still engaging and connecting them with those clinical services. So it's essentially the navigation for the family that has a number of different needs that will be met through different community providers. The bottom of page 9 shows the history of the system of care development, starting with that original pilot and grant in 2012, and the most recent law changes in 2021. We have not added the 2022. I think we're going to have to move to 2 slides eventually. But this really does show how much has changed and how many major milestones we've hit in just about 10 years. Moving on to the top of page 10 is that fast forward data. And through our 2 care management entities, you can see that it was really fall of 2020 that our second care management entity came on board, where those purple lines start at the bottom. And between the 2, 130 and 360, we are very close to that 500 number just with those fast forward families. The transitional residential enhanced care coordination on the bottom of page 10 is the same model for youth that are within a program or facility. And that started in July of 2021. And we, at the end of December of 22, we're serving 140 families. The goal is to serve all families or all youth that are in placement. As we build up workforce, we will continue to see that number grow until we start to see the number of children and youth in residential going down. But right now, to prioritize, we are serving children and families who are not in the DCYF system, that don't otherwise have a caseworker assigned that can help do that coordination. So the majority of these children and youth are not DCYF involved, with the exception of the identified complex cases and the youth at the Sununu Youth Services Center who were prioritized to receive those transition services. And then the early childhood just rolled out this summer. We received money about a year ago, and going to the bottom of page 12, at the end of the year, we were serving about 18 families, and we know that that is going up. And as we have more coordinators trained for that specific population, that we've completed or created specific training on top of the New Hampshire wraparound model training, we will onboard more and more families for that population. It is, as I said earlier, and it's on the slide on the top of page 12, eligibility can be based on exposure to ACEs and the caregiver needs, not exclusively the child's needs. And that's getting wrapped into our Medicaid state plan to be effective next July 1. Right now, it's supported with other funds, but we're continuing to grow, and hopefully, as that grows, that Medicaid benefit will come on board. Tier 4 is the residential treatment. There's been major changes with residential treatment, including moving to a contracting model in the summer of 2021, adding a whole host of deliverables, including training, data, incorporating the system of care values, where previously it was license and certification system where those met the minimum standards, and that was the extent of our oversight with the exception of investigations. Now we have required contract provisions that we can monitor and oversee and require additional data, including use of the cans, so that we really can see how those providers are meeting the needs of children and youth. Additionally, we have broken the providers up into levels of care, 1 through 5, 1 being independent living, 5 being psychiatric residential treatment facility, the most intense, the closest to inpatient, which is what we are standing up at Hampstead Hospital later this spring. So previously, there was no access for voluntary residential treatment. You had to be court involved to access those providers. We are now serving directly over 50 youth through their families. They're required to participate with the care management entity in the development of the transition plan home, because the goal is to be there for as little time as possible and successfully transition back into the community.
We're going to have to stop fairly soon, but I would like to, since Hampstead Hospital, I live in Hampstead and she lives next door, if you would address the question.
Thank you, Mr. Chairman, and thank you so much for taking my questions. How many beds do you anticipate needing and are necessary at Hampstead Hospital to house the needs of how many children?
Thank you for the question. That's extremely complex. And I don't have a quick answer for it. What I can tell you is we're looking very carefully as the data is moving and doing a much better job tracking that data. The psychiatric residential treatment facility that will be added to Hampstead will be 12 beds.
You are presuming something yet not in fact. It has not been decided, unless something happened yesterday, that this will be sited in Hampstead. I assume it will be, but that has not been decided. Am I correct?
I'm happy to clarify what I'm referring to. So currently there is plans and development of a psychiatric residential treatment facility, which under federal law is the Psych Under 21 benefit. That is a clinical service that's not the same as the discussion regarding the Sununu Youth Services Center.
Thank you. I apologize for that.
No problem. So we've been working on the PRTF for a couple years now. And as soon as construction is complete to bring the unit up to the needs for a different type of facility, that will be opening in the spring.
That's the existing building in Hampstead.
Yes.
Thank you.
Yep. It's just 12 beds within the existing facility, but we don't have that level in New Hampshire now. So any youth that needs that level of care is required to go out of state. So this is a huge step for us to start to have those first 12 beds. We hope that those 12 beds will be all we need, because we can have much better engagement and that we can have shorter lengths of stay. And ultimately that does meet our needs. We just don't know that yet. We also know that there are specialty areas such as dual diagnosis individuals and others who may still either need out-of-state care, or we may need additional 4 or 6 bed specialty units. But we're going to start with these 12 and see where it goes. So moving on to the top of page 14, our comprehensive assessment for treatment. That's how we figure out what level of care an individual needs. We take the CANS information and add family and interviews of other individuals in a child's life, including teachers and coaches and other primary caring adults, as well as review of prior documentation to establish whether or not they need residential care and what level if they do. And then we match that up with the providers who we've changed to the contracting model. On the next couple slides, you can see those levels spelled out, as well as the first year where our assessor did 768 assessments from October of 21 through September of 22. Also another area where for the first time we actually have clinical data that we can start to measure to assess system needs and how many beds we need at each level and shift our contracts and programming to respond to what we're seeing. We've never had this kind of data in our residential system before because we haven't had these assessments and this kind of tracking. So to wrap up, level 5 is that rapid response and hospital care. We have on the bottom of page 16, in the first year of services, had amazing engagement with 25,000 callers from people in crisis, 6,000 community deployments, including children and adults. And the biggest difference we see between children and adults served in the system is the rate of deployment is much higher for children. And that's consistent with the national trends, because by the time a caregiver calls, they've exhausted all of the things that they are able to do in that home and community, and they really are looking for someone to come out. And the system is based on as perceived by the individuals. And so if the caregiver calls and says, I just need someone to come, the system is intended to respond to that and go. And that happens a lot more on the children's services. So we're doing a lot of work on system improvement and measuring and looking at that data and partnering with our universities to use that data in meaningful ways. And going forward, our biggest goal is to stay the course on the amazing system that's been designed and supported by the legislature and community stakeholders, ensure that we give it the time to grow and develop and work as intended. Knowing that when we started designing and building this, we did not anticipate a pandemic and skyrocketing needs for both caregivers and children and youth. But we do have the data to show that the system is responding. Access has increased, and we still have a very long way to go. And I'm happy to send these slides so they're bigger and you can read all of it and take any questions.
Do you have a business card for each one of us or contact to your office?
The last page in this slide set has a number of different emails and contact information. My email is the top one. But we also have direct emails for inquiries to our bureau in general, which is checked by multiple people, not just me. So if it's a client question, you might send a family to the one that 3 or 4 people check, not just me. They'll get back to them faster. Fast forward, CAT referrals, and then some websites for our partners for the CAT assessment, the care management entities, Rapid Response, which is New Hampshire 988, and the Community Behavioral Health Association.
Would you save me looking up on the wonderful 2-pager that Attorney John Williams gave me, your phone number, so I can write it right in here too, please?
Sure, 271
Of course.
5006.
Thank you.
You're welcome.
And we may invite you back because we're over time now. Thank you so much for coming.
Thank you so much.
And
I'm
all the questions I've written down, I will save for another time as well.
Thank you very much.
Thank you very much. We're about to go into an executive session and to review, or maybe for the first time, in an executive session, we do not generally take testimony from the audience. You've had your opportunity to do that, both live and through emails sent to us. The chair, at his discretion, has the opportunity, if needed, to ask the bill sponsor for a clarification. And it would be a clarification on a specific point only and not a rehearing of the bill itself. This is the opportunity where we as a committee discuss it amongst ourselves and vote on it. The new rules with a very evenly divided House is that the leadership asks that the motion be made is a positive one. In other words, the motion is OTP. I erred on that. I forgot that last time and allowed an ITL motion to be made first. OTP ought to pass and then seconded, and then we discuss it, and that is the motion we vote on. In order for an OTP motion to pass, it has to have 50% plus one. A tie vote is a defeated motion. Any questions on the process of this? Anybody? Okay, seeing none. Let's see what, okay. Open the executive session on House Bill 31, an act relative to raising the age of marriage to 18. And would you like to make a motion? 34, what did I say? It's already gotten 3 older. Would you like to make a motion, Representative Lebec?
I also, I have an amendment to that bill too.
You make the motion with the amendment in one breath.
I move that we accept the amendment and move ought to pass.
Ought to pass with
With the
amendment
amendment,
number. Do we have it?
Yes.
We do?
Yes, I do.
We do?
I have copies right here.
We will.
Yes.
And that was 2 breaths, but that was a figurative saying, not literally 1 breath. And it is seconded by Representative Grossman. Amendment coming around. And you can, would you pass the amendment? What's that?
That's not the amendment?
Amendment number 49, coming this way, I think.
No.
Okay. Wow. Make sure you, does everyone have amendment? It says 0049. And we can spend a minute to do a side-by-side. Capable of contracting a valid marriage. Okay. Yeah, this is the agenda for today. Coming to you, 2 pages, the agenda for today. Please take a look at the bill as originally filed and the amendment just handed out. You will see on the amendment 0049H that there's a strike through, and that is the change that is made. I recall there was a question raised about the null and void, so the sponsor has seeks to strike that. Now discussion. Representative Moulton.
Thank you, Mr. Chairman. I like the strike through. I think that there could be potentially, there is a chance that there could be a marriage that's already underway that would be more complicated if we just made it null and void. So I do approve of this amendment where we just keep those ones intact. If there's any marriages that are already, consummated, let them go through a normal process if they're going to dissolve those. But from here on out, just not make any more. I approve of this.
Anyone else wish to say anything? Representative Gregg.
So sorry, I have to ask a question first. Are we only discussing the amendment or are we discussing the ought to pass?
We are discussing
And thank you, Mr.
the
Chairman.
amendment.
Okay. Then I don't have a question on that. I don't have anything on that. I was just getting
Okay,
clarification on
fine.
that. Thank you.
Anyone else with anything to share or discuss?
Mr. Chairman,
Yes, Representative Nelson.
thank you for taking my question. I think people are a little confused as to, are we just speaking about the strike through specifically or the entire amendment at this time?
We are looking at the amendment as it exists before you. The strike-through says the amendment takes it out of the original bill. We will discuss as amended, then we will vote on the amendment, and then we will vote, if it passes the amendment, we will vote on the bill as amended. Okay? It's an 18-point tie. All right. I will be voting against the amendment because, first of all, between the ages of 16 and 18, depending on who's doing the nose count, there's 3 to 5 marriages that have been done in the last few years. That's it. It's not that a whole bunch of eager 16-year-olds are running off to the town clerk to get married. It is a very, very small number. Secondly, they are married only with permission of the court. And while I certainly do not believe in the infallibility of judges, I do believe that when two youngsters are presenting themselves before the court to ask permission to get married, there's probably a very good reason for it. Also, it has been stated in testimony that it is impossible for these marriages to be divorced because they are underage and cannot initiate this kind of a contract, whereas the law, as I read it the other day, seems to indicate that such marriages can be dissolved. So for these reasons, plus the fact, I think the state is wise when it interferes in the rights of individuals, unless it is absolutely a clear and present need to do so. I don't see the clear and present need here and would wish for the state to not be involved in this. Age 13, yeah, I can make a case for that, and I'm glad this was voted recently, but 16 to 18, I do not see that. So I'll be voting against it. Anyone else? Yes, Representative Moulton.
Thank you, Mr. Chairman. I appreciate that you brought up the context that you would vote down on a 13-year-old getting married, but we need to draw the line somewhere. And right now, the line is at 16, and that is immature, and so it needs to be raised. And this amendment would keep intact the marriages that have already happened and would just prevent any harm going forward to minors, to children that we need to protect as representatives that are making the state law. So I still feel that this bill is good as amended. Thank you.
Anyone else? Representative Grossman.
Thank you, Mr. Chairman. You referenced good reason, Mr. Chairman. Am I allowed to? The question, wondering who defines what is good reason if two teenagers are going before the court?
The court would do that and reference my previous statement about I do not believe in the infallibility of the court, believe me, but every once in a while somebody's got to decide, and that is who in this case.
Okay. I also believe that between the ages of 16 and 18, there should not be a marriage taking place. I'm a parent to 3 teenagers, and I can't see how you can make that kind of a decision between the ages of 16 and 18 when your brain is not even fully developed. So I support this amendment.
Representative Gregg.
Thank you, Mr. Chairman. As somebody who's worked extensively with domestic violence victims, and, you know, looking at statistics and all that, you have to, and also being a committee that is, you know, for the champion of children and family, I think we have to look at the fact that we might only have 5, but we're also sending a clear message. If you look at statistics, 86% of those underage between 16 and 18 getting married are girls, young girls. They're not women yet. You also have to look at the fact that over 80% of those males that are marrying the females happen to be over 25, most likely 30 and stuff. So then we run into a situation where we have, you know, a grooming type thing or abuse. You also look at statistically what happens, because I listened to Representative Edwards about what he said in his dissent. He was the only dissent in here. He talked about you know, not wanting to give more options as far as abortion goes. So I, you know, kind of delved into what are we looking at when a 16-year-old, what are the risks if they're pregnant versus single or married? What's interesting is the abortion rate really doesn't change, but what does change dramatically is the fact of them not, and I'm focusing on women because we have 86% of the girls that are. So what changes dramatically is whether or not they finish school once they're married. So between 16 and 18, the chance of them not finishing school is over 50%. The chance of them being in a domestic violent relationship is high. I have worked in this. This has been my focus for years. And also, they cannot, so if they are in an abusive situation, they actually cannot go to a shelter for domestic violence victims if they're under 18 without a parent. So I think those are all things we need to really consider as far as what's appropriate for the law. We don't even let somebody under 18 vote. This is a big deal.
I question how you get 86% of them are girls when the total number is 3 to 5.
Sorry, I'm talking about a national statistic. And you know what, it is 3 to 5, but when you're working on a massive epidemic like domestic violence, we're working with, you know, trafficking is going up and up. We have to look at the fact that yes, it might be 3 to 5, but if your child was one of those 3 to 5, it would be a much bigger statistic.
My child would have to have the permission of the court for reason. I don't think domestic violence would be one of those reasons, or I don't think trafficking would be. So I'm wondering how this enters. I'm going to call on somebody else. We may get back to others. Representative Nelson?
Thank you, Mr. Chairman. I have a couple of points here, and one of the points is going back to what you alluded to regarding whether a married person who is a minor between the ages of 16 and 18 would be allowed to seek legal help, hire an attorney, go to a domestic violence shelter. And in this section 21B3, it states that the certificate of marriage shall provide evidence of a minor's emancipation. And the definition of emancipation is I'm sorry. I had it right here. The primary benefit of emancipation is legal autonomy regarding one's financial and personal affairs. So I do believe that they would have access legally to sign into a contract with an attorney. I did check with a domestic violence program here in the state, and I was told that no one, regardless of age, would be turned away. So I disagree with that. I'm not sure if I'm supposed to disagree, but I'm just stating that I believe that the answer that I was given to be true. And that's it. Thank you for your time.
Thank you, Representative Long.
Thank you, Mr. Chairman. Yeah, it's not complicated to me. The fact that the legal system has to okay a marriage is the problem for me. If I had a daughter and she came up to me and said, or the gentleman came up to me and said, is it okay if I marry your daughter? I wouldn't say, let the courts decide that. Okay? So the fact that you're not 18 years old and you need to go to court to get permission to get married is problematic, plain and simple. Thank you.
Okay, don't repeat what you've already said. If you have new information, say it, and briefly, please, Representative Moulton.
Thank you, Mr. Chairman. To circle back to the domestic violence portion of this, I can tell you that domestic violence abusers, they will wait until the relationship is secure in the form of a marriage before they first strike in multiple situations. I can tell you that from my personal experience, that they wait until they get married first, and then they become violent. They're not going to show their violent tendencies when the relationship is still frail and someone can break up easily, because they want, it's the mentality that abusers have.
Thank you. Anyone else? Yes, Representative Bickford.
Thank you, Mr. Chairman. Well, based on that testimony I just heard, that's a good reason not to get married.
Ever.
But going beyond that, two things. One, we do allow people, 16-year-olds, to go hunting and by themselves. They can have a rifle if they take a National Rifle Association class. We also let them buy automobiles, so we do allow them to do dangerous things. And but I do not understand the strike through and why it's even in the original one. And if anybody can help me with that, that would help me.
Representative Levesque, would you explain the strike through, please, in the amendment?
So the strike through it's happened before. I've had to amend it before when I put this bill through. The strike through gets rid of all marriages contracted by such persons shall be null and void. What it would do is just making sure that those people that have gotten married before this is enacted, their marriages are still intact, but this bill would just make sure that there is no further anybody under the age of 18 getting married. This just prevents further marriages, not ones that are.
The humorous irony is they would be grandfathered
Yes.
Oh,
at such an age, yeah.
looks the opposite to me. Okay.
Representative Panic.
Thank you for taking my question, Chairman Pearson. Usually, if a child is getting married at 16, and I'm not saying that they're not a little immature, it's because the girl is pregnant. And if you're not going to allow this consummation of marriage, you're forcing this situation. If they believe in life and they don't believe in abortion, you're kind of putting them in a situation to become more dependent on the state rather than letting the couple support this welcoming gift. And that's my take on it. Thank you.
Representative Raymond.
Thank you. Thank you for letting me speak. So I have three main points that I wanted to make here. The first is that I approve of the amendment, the strike through. I don't think that we have any business dissolving marriages that have already occurred. Just as a point in general, I don't think that the state should be interfering with legal contracts that have already occurred. The second thing I would say is that regarding having a child out of wedlock, it's 2023. More than half of children are born out of wedlock these days. That's now normal. And children under the age of 18 are not able to purchase their own health insurance on the marketplace, even if they are emancipated, which getting married does. But in those cases, you are not able to purchase your own health insurance on the marketplace. We also have in state law child labor laws that prevent children ages 16 and 17 from working full time and thus being eligible for health benefits through their employer. Therefore, the only option for a child who is pregnant under the age of 18 is to A, be on their parents' insurance, which they are legally required to provide until the child is 26, or B, Medicaid. That's it. Those are the only options in the entire country of the United States. So, an argument that we should be allowing children to engage in a legal contract with another person who may or may not also be a child for the sake of a pregnancy doesn't hold any legal weight here. There's no benefit. In my opinion, one of the biggest requirements and responsibilities of this committee is to look at every potential bill that comes across our desks and view it through the lens of what is in the best interest of the child in this situation. And so when I look at this bill, as I'm looking at other bills that we are talking about, I'm asking myself, what is in the best interest of the child in this circumstance? Be it a male or a female, is it in their best interest to enter into a legally binding contract when they are not allowed to enter into any other legally binding contracts? We have laws against child labor. We're saying that they're not old enough or developed enough or responsible enough to work more than 30 hours a week. Therefore, we should continue that logic. As a society, we have been moving towards the idea, as we develop, that people do not become adults until they have finished high school and or turned 18. That's consistent. It's consistent in our child support laws. It's consistent in our labor laws. It's consistent in our education laws. And I don't see why marriage, as this random legal contract that is intended for combining the assets of two individuals, would be an exception to this rule. So,
Thank you. Anyone who has not spoken? The chair is going to call the question, which means we vote on ending discussion. I think we've heard everything. I'd like to see a show of hands. How many support the calling of the question, i.e. we now proceed to vote? Okay, good. Now, the motion before us is the amendment that you have before you with the strike-through. That is what we are going to be voting on. The positive motion is to accept the amendment. If you accept the amendment, that doesn't mean you have to accept the bill once it's amended. You could do whatever you want with the bill once it's amended. This is simply to accept the amendment. If you accept the amendment, it's an aye vote. If you do not accept the amendment, it is a no vote. Would the clerk please call the roll?
Chairman Pearson,
No.
Representative Long,
Yes.
Representative DeSimone,
No.
Representative Bickford,
No.
Representative Nelson,
No.
Representative McMahon.
No.
Representative Ball. No. Representative Panic.
No.
Representative Seidel.
No.
Representative Grossman.
Yes.
Representative Levesque.
Yes.
Representative Petrino votes yes. Representative Perez is absent. Representative Gregg.
Yes.
Representative Moulton.
Yes.
Representative Raymond.
yes.
7-8.
The amendment is
Fails.
accepted by a vote of 8 to 7.
No, it's opposite. It fails. It fails 8 to 7.
Thank you. If the amendment does not pass, the motion now before us is ought to pass on the original bill. So set your amendment aside. We now have the original bill with the strikeouts back in. All marriages contracted by such person shall be null and void. The motion I think I don't have to do it, but just to be sure, I will. Would you move OTP to the bill, please?
I move out to pass.
And do I have a second? Second, so it's the same as before. Just to be sure, I think we didn't have to do it, but we made sure. That is the motion before us, ought to pass. Moved by Representative Levesque, seconded by Representative Grossman. If you are in favor of the bill and the motion ought to pass, you will say yes. If not, you would say no. The clerk may call the roll, please.
Chairman Pearson,
No.
Representative Long,
Yes.
Representative DeSimone,
No.
Representative Bickford,
No.
Representative Nelson,
No.
Representative McMahon,
No.
Representative Ball, Representative Panic,
No.
Representative Seidel,
No.
Representative Grossman,
Yes.
Representative Levesque,
Yes.
Representative Petrino votes yes. Representative Perez is absent. Representative Gregg,
Yes.
Representative Moulton,
Yes.
Representative Raymond.
Yes.
The bill fails by a vote of 8-7.
Thank you. And we'll see you next year. Will you do the minority report? Who will do the majority report? Is there anybody who voted on the prevailing side who would like to do it? I'll be happy to. Thank you. Yes. Representative Nelson said she would.
I'd be happy to, Mr. Chairman.
Oh,
if you
you're even
would.
happier than I'm happy. Thank you.
Okay.
So you don't do ITL anymore? Is that it? Oh,
That's what
okay.
we've been instructed to do. They want a positive motion, even though the majority of it may vote it down. They want a positive motion.
But when it goes to calendar, there's no ITL like it used to be.
You should take a motion on ITL. So that it can be reflected. It's not going to be reflected. It's going to be OTP in the calendar.
OT. It makes sense. Let's do it. We may not need it, but just to make sure, let's do it. All right. I
You-
will
you
accept the
shouldn't-
motion on ITL then. I don't think we need to do it.
Did you make the motion?
I make the motion.
All right. And a second, DeSimone? So we're just doing it mirror image. I'm not sure we have to do it, but you've been doing this a lot longer than I have. So if we do, we're doing it.
I mean, you would
When
think.
you're ready, the chair
you
will
wouldn't think
make the
you would need it,
motion,
but-
ITL on House Bill 34 FN. The motion now is ITL, moved by Representative Nelson, seconded by Representative DeSimone. And the clerk may call the roll, please. If you are in favor of ITL, say yes. If you are not in favor of ITL, say no. Everybody got that? We had to redo one last year. But anyway, okay.
Chairman Pearson,
Yes.
Representative Long,
No.
Representative DeSimone,
Yes.
Representative Bickford,
Yes.
Representative Nelson,
Yes.
Representative McMahon,
Yes.
Representative Ball, Representative Panic,
Yes.
Representative Seidel, Representative Grossman,
No.
Representative Levesque,
No.
Representative Petrino votes no. Representative Perez is absent. Representative Gregg,
No.
Representative Moulton,
No.
Representative Raymond.
No.
ITL is 8-7.
Question.
I'm just curious if we did have full attendance today and the vote would have been 8-8, what would have occurred?
It would have gone down. 8-8 is a no vote.
No recommendation. Okay, thank you.
Open the executive session on House Bill 200, choice of a counselor, to evaluate a child in family court proceedings. Do you have an amendment? And I will bring this forth on behalf of Representative Nutter Upman. Upham. How long have I known, have I been doing this as long as I've known you? Upham. Representative. I move ought to pass with the amendment that is, I think, 0010H. And it's coming around. It's coming, it should be coming around.
We already had a copy.
I think so. You've already had a copy, but we've got another copy of it. I think you're all set, but there's another one, nice and clean.
Mr. Chair,
Yes,
is this amendment 0010H?
yes it is.
Thank you.
We had discussed whether we needed to have a different amendment because we were unsure about insurance issues. So the chair will call the representative from Health and Human Services and Elderly Affairs, my dear friend, Representative Nutter Upham.
Thank you, Mr. Chair. There,
Upham, yeah.
there were a couple questions that came up last time, and former Representative Mel Moran, who runs several therapy agencies, answered quite well the question of insurance, because he said any child in New Hampshire who doesn't have insurance, the companies will help them apply for insurance because they're eligible for insurance. So I didn't feel that it was needed to put it in the amendment because it already exists.
So the people who would be directly involved with the issue at hand say there is no issue, no problem. The problem we raised is not a problem.
Exactly.
Okay, thank you.
Okay. Was there one other question on here?
It's only by way of a clarification where there has not been.
Okay.
Yeah,
Thank you.
welcome. Any discussion on the bill?
Second motion. Second on motions.
This is true. Okay, so Representative Pearson moves HB 200 with Amendment 0010, and Representative Long seconds it. Any further discussion? Representative Raymond.
Thank you. And thank you for addressing the question regarding the insurance coverage. I just wanted to speak towards this bill. I think that we had quite a bit of public testimony, and I've had constituents reach out to me indicating that this bill would have made a difference to them during their custody proceedings. And so for that reason, I am convinced that passing this is the right thing to do.
Any further discussion?
I hear,
I'm sorry?
right here,
Oh, Representative Bickford.
I am, as you may know, in bewilderment over the clause, or in the event that a finding of abuse has been made, and why that would disqualify them from agreeing with their former partner.
May I call the prime sponsor back for a clarification, because, my liberal arts mind could read this three different ways, and it's a blessing, but it's often a curse. So what does it mean?
Thank you. The concern was, and I spoke with Catherine Coco, who's the head of New Hampshire Legal Assistance, and she also ran it by Waypoint, which is the children's advocacy group in New Hampshire. And their concern was they didn't want an abusive parent overwhelming the other parent in choosing a counselor. So only in the case of abuse, one of the parents is abusive, it is likely that the two parents would not agree on a counselor. And so only in that instance would then the court make the decision about who, making a fair and even decision about who the counselor would be.
Follow up, Representative, you okay?
Okay.
Okay.
And I
good.
think it would discourage marital wars over what counselor that they were going to pick.
Thank you,
thank you for your
Representative Nutter Upham. Anything else? Anyone else? Well, the motion before us is the motion before us is Amendment 0010H. And I can take, they tell me, a show of hands on this. How many of you are in favor of the amendment? Okay, it's unanimous. And now we do have to do a roll call on House Bill 200 as amended by Amendment 0010H, moved by the chair and seconded by the vice chair. And would the clerk please call the roll? This is a positive motion. If you're in favor, you vote aye.
Chairman Pearson.
We are actually in the voting mode.
I'm sorry.
I'm sorry?
I was
Oh,
sorry.
all right.
First.
The assistant clerk's maiden voyage, calling the roll. No pressure here.
Sorry. Chairman Pearson,
Yes.
Vice Chairman Long,
Yes.
Representative DeSimone,
Yes.
Representative Bickford,
Yes.
Representative Nelson,
Yes.
Representative McMahon, I'm so sorry.
Who?
Rep-
Oh, it's me.
McMahon.
Oh, yeah, yes.
Sorry. Representative Ball, yes. Representative Panic,
Yes.
Representative Seidel,
Yes.
Representative Grossman,
Yes.
Representative Levesque,
Yes.
Representative Petrigno,
Yes.
Representative Perez is out. Representative Gray,
Yes.
Gregg. Representative Moulton,
Yes.
Representative Raymond.
Yes.
That's one. That's 15. Yes.
The motion passes 15-0. Now, Assistant Clerk, what question should you ask me?
Do we have a motion for an ITO? No.
No? No?
What? Is it the
No.
big one? I have to go off.
Anybody? What's the next thing that should be asked? Go on consent calendar, because it's, yay, how many, yes, no objections. It's on consent. Wonderful. It makes everyone happy. Gosh, do I get to write the blurb? I guess I do. All right. I'll learn my lesson on that. Now, open the hearing on House Bill 471. This is the hearing on House Bill 471. And 471, do I hear? Who's the prime sponsor? I've lost my... Is that why Representative Yocella is sitting there? Representative Yocella, an alumnus of this group.
Yes, thank you. Thank you, Mr. Chair, and thank you, members of the committee. I am here to introduce HB 471. It's just trying to speed up the process as far as, or encourage the judicial system and the lawyers to speed up the process and reach a conclusion in divorce cases by when a temporary order is given that the court shall schedule a final disposition hearing. And they would be able to reschedule that for just cause. But there's a couple of things that at the temporary order, they have some sense of the case. And so they should be able to know or have a better idea of how long the case is actually going to need. And so they're is so that they would be able to schedule it, because sometimes that a case may be an hour long or multiple days long. And so at this temporary order, they would have some evidence of the complexity of the case. And then also in HB 124 from Rep. DeSimone that you guys heard on the 10th, there is not for alimony, temporary alimony, it is not counted towards your time for total duration of alimony, which is set right now to be half the time of the marriage, the maximum time. So if you drag on having temporary alimony for a year or 2 years, then that's really eating into it's not really making our limit of the temporary alimony, or the limit of alimony being half of the marriage, really appropriate. Hopefully, I'm not sure if you guys voted that one. HB 124 ought to pass, but hopefully that will be another way of addressing kind of ongoing temporary alimonies that just live in for a year or more. But the idea of this is just to have something on the books so that everyone knows kind of like we're shooting for this date as far as ending this proceeding, so that the courts are not tied up as long, and also just have everyone kind of on the same page and shooting for the same goal, instead of just issuing the order and then it just be kind of out in the void about whether or not when this divorce is actually going to end, like the divorce proceeding is going to end. And so that's kind of my gist of this bill. And there was some suggestion of the judicial branch using their scheduling conference order and from a constituent, but I don't believe that the scheduling conference order, it's kind of like a checklist of things that they could order, and so I don't think it's appropriate to what I'm trying to do, which is actually get a final hearing scheduled on the book so everyone's shooting for that date. And so hopefully you will be in favor of this and vote it off to pass. I'm happy to answer any questions.
Questions, anyone? Representative Bickford.
Thank you, Mr. Chairman. I'm not that familiar with what happens now, but I have heard people say it takes a long time. And is that what we're trying to address here, is the on and on and on? So if you could elaborate on that, please.
Yes, thank you for the question. It is my understanding from the testimony that I've heard before when I was on this committee, and then also from lawyers, that they do see that cases are dragging unnecessarily long, and one of the reasons is that there is no like set final date, and so they're just making motions whenever they feel like it, and not really trying to reach a resolution by a specific date. The lawyers, if it drags on for a longer amount of time, they're going to get more money. So there's no real incentive for them to call for a final hearing. And so that's one of the reasons why we're trying to kind of incentivize the courts to say, hey, this may not be the final date, because they could motion to say, hey, we need a longer time frame. You scheduled this for a 2-day hearing and it's going to be 4 days or something like that, so we need to reschedule. Or there's a legit reason that we need to reschedule and it needs to be pushed out further. But it's my opinion that they should kind of have to prove that that's necessary. Otherwise, they should try and resolve this within a reasonable amount of time. Thank you for the question.
Any further questions? Representative Raymond.
Thank you. So currently, when people seeking divorce go to court, the court issues the temporary relief, and then they order the parties to mediation, and they have their court ordered time for mediation. You want them to also, at that time before mediation happens, order basically a trial date for the dispositional hearing? Is that, just so I'm understanding what what the bill's intention is?
I am not 100% sure that that is the normal flow. Like, I think that they could go to mediation before the temporary order. I'm not sure that that is completely like the exact flow. And there obviously Richard Head is here, and he will be able to answer kind of like that flow as far as that, and he's more of an expert on that.
Thank you.
Yes, Representative McMahon.
Thank you, Mr. Chairman. Just one question, sir.
Sure.
Do you disagree with the methodology description that states when temporary orders are issued,
That it's going to cost more money?
that it's that there's not a due process time if attendant, should there be conflicts in an express or implied agreement on what happens next if something else comes up? I know there's a cost issue there as well, but it's saying there's inefficiencies in the court schedule to then hear complaints or disagreements and be prior to the final disposition.
Thank you for the question. I think you're talking about the sentence that says the branch states that the bill may result in significant inefficiencies in the court schedule by booking hearings without knowing time restraints or if hearings are needed.
No, if I may be, it's the third sentence. Less likely to know what issues, if any, will be contested by the time of the final hearing. Isn't due process then affected, for either party?
Thank you for the question. I don't believe so, because if there was an issue that you needed to address before the disposition, you could then just request the hearing be moved. Under the language of the bill, the second sentence says the court may reschedule the final hearing for just cause, so that the lawyers could just ask and say, hey, I need to have a hearing on this, and it needs to be heard before the final disposition hearing, and so we need to push this final disposition hearing out another 3 months or whatever. So I do believe that all of those issues would be able to be addressed, and it wouldn't be contrary to either the person's rights for what they can have hearings on, or contrary to like the best interest of finding justice. Thank you for the
Thank you,
question.
Mr. Chairman.
Anyone else with a question? Representative Gregg.
Thank you, Mr. Chairman. Thank you for being here today and presenting this. So I just wonder if, it says that they can reschedule with just cause or whatever. How does this tie the courts if like the day before they decide, oh, we can't do it tomorrow? The courts have this date reserved, and what that does with like costs, effectiveness, all that kind of stuff. Like you need to, like, if we're going to say, okay, you have to set this date, there's no like cancellation policy of like, we need to change it, like thinking in today's terms, like what does that do as far as like, I would think that could actually complicate it and back up the court more, because if we have dates reserved and then we're not using them, too close to time, does that make sense?
Thank you for the question. I believe that just cause, like you got hit by a bus and you're in the hospital and you can't attend the hearing, that seems like that could happen at any hearing the day before. And so I'm not sure that this would necessarily be any different than any other time. And it would need to be appropriate. The judge would make a call if it's because you weren't able to find a babysitter, but you had 9 months notice. The judge would probably be like, that's just too bad. You're going to have to, we're not rescheduling for that. That's not just cause, right? So it would be up to the judge to make that determination. Thank you for the question.
Follow up.
Thank you. So I guess it's not so much like hit by a bus. Obviously, we can't help that kind of stuff. It's more like, so there are certain times, let's just say in contested divorces or whatever, where you're supposed to have financial disclosures. But maybe if you already have this date set, sometimes financial disclosures come, a month before or whatever, or 2 weeks before. You have a grace period. Okay, you have to get that in there, but the financial disclosures aren't coming. I mean, divorce is never really a happy thing. So there's a lot of times, a lot of, kind of conflict in one party or another, not giving what they need to give. And so I can see actually just cause being pretty broad as far as, okay, well, this party didn't give this. And so I guess I'm just wondering like, what the provision would be like, if there would be any kind of like time frame, just so we're not hanging up our courts and stuff. That's my only thing with that. Car accidents, totally different.
Thank you for the follow-up. I'm not, I guess, I'm not sure how the courts are tied up if they are not having the hearing. If they know, multiple weeks in advance, because they're supposed to be, exchanging, evidence multiple like weeks in advance and all of these disclosures. Now there's a bigger problem of people not actually exchanging those and no enforcement mechanisms happening as far as that. And I do think that kind of goes back to the question about whether or not you can actually represent yourself or defend yourself, or is justice being served if these things are not actually happening. And so I'm definitely more concerned about that than scheduling out, because I assume that they're going to be scheduling out a decent amount of time, like 6 or 8 months. It's not going to be like next week we're going to do the final deposition hearing. And so you'll have plenty of time to know what the final date is and be shooting for that and trying to get things resolved, months in advance. And if you're not able to, then you would be requesting a continuance and say that, just cause we haven't been able to resolve this. We thought we were going to be able to resolve, my Bahama house and we're not able to. And so we're going to need to push it out another 3 months or something like that. I think that it would be rare that it would be in such a short time frame before the hearing that the court would essentially be forced to be empty for that, because there's no cases to schedule in that time frame because there was such short notice, kind of a thing. I'm not sure that how often that would be the case, but obviously Richard Head will be here to tell you that it's impossible, so. Or very common.
Representative DeSimone.
Thank you, Mr. Chairman, and thank you for taking my question, and welcome back.
Thank you.
I just want to be clear that this bill does in no way prevent anybody from applying for a continuance at any time. Am I correct?
Thank you for the question. Yes, this does not mandate that the court schedule a specific time frame. It doesn't say that you're not able to get a continuance. It's just trying to put something on the books so that everyone is shooting for a goal and not mandating that you have to do it within 6 months or a year or whatever. If the courts, were able to schedule out 5 years in advance, they could schedule it out 5 years and be in compliance with my bill. There's no, it's just trying to have an end date. Thank you for the question.
Seeing no further questions, thank you for your testimony, Representative.
Thank you.
And now we call on Attorney Richard Head.
Good morning, Mr. Chairman, members of the committee. My name is Richard Head. I'm the Government Affairs Coordinator for the Judicial Branch. We do not support this bill, and I just want to briefly explain why that is. One of the sort of what I would describe as the most important and valuable resources the court system has is the court's docket. That's the place where where everyone's hearing is going to be scheduled. And when a hearing is scheduled, someone else's hearing cannot be scheduled, obviously. So, to the extent somebody is getting a hearing, it means somebody else is not getting a hearing. It's just sort of the inevitable process of blocking off time on a docket. The other aspect of this bill is that one size does not fit all. Cases are different. And each case has its own sort of issues and process. And early on in a case, we do not know what all the issues are that are going to be heard at the end of the case. There is a process and a goal of the courts to have the parties reach agreement and to try to resolve issues. And as issues get resolved, the time necessary for a final hearing, which is essentially the final trial, hopefully become less complex, and the amount of time needed for the hearing is reduced. So one question is, early on in the case, how long do we schedule the case for? A final dispositional hearing can take an hour. It could take 2 days. It could take 5 days. It really depends on who are the witnesses, what are the issues, what needs to be heard, and they're not sort of known early on in the process. And the other aspect of this is this bill would trigger the court's obligation to schedule a hearing, or the final hearing of some length of time, whether it's an hour, 2 days, 5 days, at the point of the issuance of a temporary order, and it's amending RSA 458-16. So I think it is important to understand what is a temporary order and when does it happen. So a temporary order under in sort of a list in RSA 458-16, it also says very specifically temporary orders can be ex parte. These can happen very early in the process, essentially at the point of filing. Directing any party to refrain from abusing or interfering in any way with a person or liberty of the other party, enjoining any party from entering the premises, enjoining any party from contacting any other party. I'm partially reading these for time. Enjoining any other party from harassing, intimidating, or threatening, determining the temporary custody and maintenance of minor children, ordering temporary allowance, enjoining a party from transferring, encumbering, hypothecating, concealing, so on, et cetera, property. Those are the temporary orders that get issued. So some of these might even occur before a party has appeared. We don't know anything about the case. We only know that there's an initial filing. There's a request for a temporary order. It may be ex parte, it may be with the parties. Ex parte meaning the other party's not there. We don't know anything about the case at that point in terms of being able to intelligently identify when, how long, sort of who are the witnesses, what's going on in that final hearing. Even if we got a little bit later into the process, there are potentially, in not all cases, some cases can in fact be scheduled relatively early, but types of issues that judges see in divorce cases. Are there abuse and neglect issues? When you get into the financials, is there a business? Does there have to be a business valuation? If somebody is self-employed, is there a self-employment valuation needed? Is there a house at issue? Does the house need to be appraised? If there's a guardian ad litem, how extensive is the guardian ad litem's involvement going to be in a final hearing? What are the support issues? Income and expense calculations sometimes require some iterations. Asset valuation generally, if they have IRAs, Roth standard stock options, those need to be potentially evaluated and valued during the course of the discovery in these cases. If there's an underemployment issue, somebody is underemployed, how is that information and evidence going to be discovered and ultimately presented to the court?
are there child counseling issues? Do we need to get through a process with a child, or does there have to be a temporary parenting order in which the parties in the court need to evaluate, is that temporary process order working in a way that can be put into a final order, or do adjustments need to be made, because ultimately adjustments are easier in a temporary order than coming back after a final order is issued. There are a lot of moving parts. It's complicated. And what this bill would propose is that in all cases, we have to schedule a final hearing at the point of a temporary order. And just creates a significant burden on the courts and our ability to move things quickly. And we do think at the end of the day, this would create potential delays, because if we get a motion to continue that trial 3 weeks, 4 weeks before, if we have 2 days set up for a trial here, yes, we can fill it with stuff, but it's not going to be somebody else's final order, because that's already been scheduled, because we scheduled it a long time ago. And also, parties are not necessarily going to be ready on that day and time when they already have another hearing scheduled. So it is a potential where we are setting aside time that ultimately does not get used, and it's not being used as efficiently as it can. So I don't think simply saying that the parties have their authority or the ability to seek continuances really provides an efficiency. And in fact, you'll hear from some judges that motions to continue are really discouraged, because again, we're talking about a very valuable asset in the court's docket. And once we've scheduled something, we want it to happen when it occurs, because it can be very difficult to sort of backfill that space, especially if there's not that much time available. So we think, it does create some significant problems. If there is a specific issue, as was discussed with regard to alimony, we didn't take a position on that. If there are specific issues that need to be addressed, I think those can be addressed on a sort of issue by issue basis. But to sort of mandate on all cases and all time, in all circumstances, a final hearing be blocked off on the court's calendar, that blocking off creates a significant number of scheduling problems. What we do want to see is, when the parties know what the issues are, when those issues have been identified by the parties, and we've been hopefully successful in narrowing those issues, which is our ultimate goal, we can then set the final trial date. We know how long it's going to take. We know we get a pretty good idea who the witnesses are going to be, and ultimately the parties really do have a better sense of what they need to do and when they can do it by, and that's how we do schedule things. With that, I'll conclude my comments, but I'd be happy to answer any questions.
Representative McMahon.
Where are we? Good morning, Attorney Head. Thank
Still
you
morning.
for being here, sir. Specifically to go on what you just provided your guidance on, if, and with the statement in the bill stating upon the issuance of temporary orders, and that timeline you implied was to know what are the issues in dispute, that's my word, but in dispute, is that once that is known, would you consider to facilitate an orderly progression of resolution, that a timeline as set by the judge, knowing what the schedule is, would be the final disposition shall be on this date? And is that not an appropriate incentivization of completing the proposal at hand?
So thank you for the question. A couple issues. One is, as I mentioned, at the time of temporary orders, which essentially can be, essentially shortly after the filing of the petition, there's not a lot of information. But once we are scheduling something for a final hearing or a final trial, that's now blocked off on our calendar, and sort of nobody else is touching that time. At the time of the temporary orders, we don't have enough information to be able to establish how long do the parties need for discovery, how long do will the parties ultimately need in terms of trial time, and And it really is not appropriate at that early stage to be able to set it. What we do look for is we have at the initial sort of conference, parties are with some exceptions, told to go into mediation. We work on trying to resolve these issues. They're told to work with a court staff person to try to identify what ultimately is at issue in the trial. And then they come back after they've had the opportunity to exchange the documents, to try to mediate, to work with court staff to reduce and identify the issues. Then they'll come back to the judge and at a pretrial or a scheduling conference, when those things are resolved and identified, and at that point the trial is scheduled, and depending on the court's docket, whether it be 3-4 months from then or 2 months, it just depends on what is available at that time. But there is a process. We do try to resolve these cases within a year. If there are no parenting issues, they're generally, we're at around 92%. If there are parenting issues, in the low 80%, in terms of being able to have these cases hit their final hearing within a year. Doesn't mean they all do. It doesn't mean we can't sort of do better. What I think really what is paramount is getting some more resources into the court, so we have more staff, more judges available, so then we have more essentially docket times available in order to fill more cases into our dockets.
Seeing no more questions, thank you, Attorney Head. And the chair calls Rich or Rick Clark. Rich or Rick? All right, the chair recognizes me. Oh, wait a minute. And it's Rockingham 32, Portsmouth, right? Thank you. You may not only sit, but engage your microphone. That's a twofer.
Perfect. So my name is Rich Clark. I practice law in Portsmouth and have practiced family law in most courts in Rockingham and Stratford County. And I'm here today because I have a lot of clients, friends, family that tell me the horror stories about our New Hampshire family courts taking years and years, and they go on, and people are tired of it, and we want closure to our divorces, and that is why I'm here. So the temporary order hearing addresses two things. It addresses money and custody. I can't think of much else that it doesn't follow in, but those are the two most common things that they address. When I meet my clients in that first hour, no matter whether they have multi-million-dollar businesses or whatever they're doing, the size of their estate doesn't matter. I know in an hour how to resolve the case. In the last 3 years, I think every case I've resolved once the client comes to me within 65 days of meeting the client. So the complexity of the case to me doesn't change by how much money somebody has. Those temporary orders, they sound temporary in nature, but they're not temporary. Those temporary orders stay in effect until the divorce is finalized. The court is well aware of what will happen, and they know the facts of the case and how complex or simple it is after the temporary order hearing, because custody issues and money is addressed. All of those things are outlined. And quite often the court has already tried these facts, so they'll adopt the temporary orders into their final hearing. The time that it takes for New Hampshire divorces, some of these to go on and on for years, it's unreasonable. Myself, including other attorneys, other litigants, have filed for a scheduling conference just to get a final hearing date. People want to get them done. I filed them 6 months after the petition was filed. The court will deny it. We're only asking for a final hearing date because we want to get this past us. We want the damage to stop and we want it to move on. Others have filed them 1 year after their divorce was petitioned, and the court will deny just getting a final hearing date. It's outrageous, and these are the things that need to change. And I'll address the money issues of saying this is going to create a burden to our court. I think that's wrong. It's wrong because in the criminal court system in New Hampshire, the court will automatically schedule many things, including the final hearing date. Yes, most of these, I think 98% of them are pled out, and they're pled out, and the clerk simply removes that final hearing date. And someone else takes that spot. Something else will always fill the spot. And to say that this is going to be wasted time, I think that's wrong. And I think we can look to our criminal courts because they automatically schedule those, and it's not an issue. This bill simply requires the court to schedule a date. The court can say this is a complex case. We're going to schedule out in a year. They could say this bill doesn't limit the time. They could say we're going to schedule out in 2 years. It's just giving us a date of when we know it'll be done. The final hearing notice, there was a question that one posed, and that was about deadlines and discovery. The final hearing notice tells you what is due, when it's to be sent. So we are aware of the deadlines. That's not an issue. The continuance of the hearing date, I had a hearing once and my mother died. And so I requested the court on an emergency basis to continue it, and the court granted it. The court is very reasonable when it comes to granting continuances, but they have to be for just cause. It can be a health reason, whatever the reason is for continuance. It's not something that should give you any concern, because I find that the courts are very reasonable in how they deal with continuances. To address the issue of the cost to the court, upon the temporary order hearing, which is typically heard within 4 months, and my guess is that they would schedule the final hearing a year after. So that's a year and 4 months. So to address the cost issue, I can tell you from my experience that the time going between the temporary order hearing and the final hearing, there are needless motions that are filed. When these motions are filed, objections are filed, and then responses are filed. And I can't tell you in a typical case how many hours are wasted of the court's time and judicial resources because we don't schedule a final hearing. If we simply schedule the final hearing, the cost to the court staff, to the judges, would be minimized. If there is needed more time for a hearing, a party can always request to schedule that. You can do a motion to exceed time limits, so you can request it to be an hour and a half or 2 hours, whatever it might be. I'm here to represent the general public. I'm not here to represent the New Hampshire Bar. And what I can tell you is that, in my opinion, if this were done and these cases were expedited and a final hearing was scheduled, it would lower the litigants' attorney's fees. That I'm certain of. When a case is done, they don't drag on, and who it helps is it helps the litigants so that they're not charged because these cases continually go on forever. My clients have anxiety and stress when they're going through their divorces. I'm still smoking cigarettes from my divorce 2 years ago. And I can tell you that I went through a remarkable amount of stress because my case alone went on for years. For years. It's too long. Is that reasonable? I can tell you it wasn't reasonable, and I went through it. And I see others go through it, and it's not right. Most importantly, the damage is done to our minor children. Maybe you won't go through a divorce, but maybe your kids will. Maybe your grandchildren will. And who am I here to support mostly? It's the minor children that go through a remarkable amount of trauma when these cases go on because they know their parents are fighting. They can sense it at home, and it's our courts that allow this to go on and on for years. And what happens to the mental health of our children when these cases go on and on for years? Clinical studies, they show that they become addicted to drugs and alcohol. Crime is more prevalent. Why do we need this to go on for years? We're asking for a simple cause here, and that's just to schedule it. The court could even schedule it 10 years out if they want, by the way this is written, but we're just looking for a final date. 1 in 2 marriages will end in divorce. 2 of mine have. So it happens to many people, and the probability of it happening to us or someone in our family is very common. You have the opportunity today to protect our children, to limit the injury that and the trauma they will go through, to help our litigants just seek resolution and finality at a reasonable time frame, and that's all we're asking. Thank you.
Attorney Clark, would you take questions?
Yes, sir.
Representative Grossman.
Thank you, Mr. Chair. I'm just curious. So when you mentioned people are getting denied requests for that final hearing, are they given a reason? Are there reasons for those denials?
To quote a few, it says denied, and that's the reason. And to me, in those cases that have been involved with, there's no cause to deny them, other than the court docket. I'm just assuming they're busy or they don't want to deal with it. But to file those a year after the petition has been filed, and for me to hear stories of those that are denied, that's why you can have a good judge that will make a good decision. I hail from one of the best family courts in the state of New Hampshire, and that's Portsmouth, where we have a great judge. But if you trust the discretion of those judges some of them aren't competent, in my opinion, and we need to create law so that we just get a final hearing, because to deny them a year after, that's unreasonable. A year after the petition is filed, knowing that we're going to get typical trial date a year after that. So that's what I'm trying to hopefully prevent.
Follow up.
And another question, not related to that one, but so are you finding that more motions are being filed because that final hearing is not set? So instead, they're going back to court to try to make things.
Without question.
Okay.
And those filings and motions and then objections and then responses and hearings often take longer than the final hearing itself. Thank you.
Anyone else? Representative Raymond.
Thank you, Mr. Chairman, and thank you, Attorney Clark, for coming and speaking to us today. So I have to apologize. My experience is mostly with the DCYF end of things. So my experience in court has been you file a petition, and then there's timelines. Like 3 months later, you go to court, and then 3 months after that, you're going back to court again and again until a TPR. So obviously divorce is very different from that. Are there any trigger points that bring where somebody involved in a divorce would know that upcoming they're going to be going back to court, so that there's not, or is it just like a lag? Like you get your temporary orders and then you just kind of like wait in Neverland until something happens?
It's the Neverland.
Okay.
Absolutely.
All right. Thank you.
Representative Bickford.
Thank you, Mr. Chairman. Do you think this is because the court is now overloaded? Do we have more divorces going on now? We don't have marital masters anymore. Did those get replaced? Is there a reason for this to go on? And Attorney Head said that at this temporary level, it's too early. It's too premature. That's what I got out of what he said. And maybe there's another point where it should, as I heard, trigger. So those are my questions, if you can help.
I've been practicing for 15 years, and this has been happening that long. So the cases in New Hampshire family courts drag on and on. It's not a recent problem. This has been ongoing. It's been long-term. And I think the complexity of the case issue is a very weak one, respectfully said. This is just in my opinion of practicing, because I can tell you in the first hour in meeting the client what the issues are, how to resolve them. And again, it's always two things. How do we split your assets in half, typically? And let's do a parenting plan. And the parenting plan that New Hampshire has compared to Massachusetts, when I was practicing family law there very often, it's 9 pages. It's done very well. A layperson can look at the parenting plan. That's half of the divorce. Very simple, very well done. You don't need an attorney for it. Our issues in that temporary order hearing, they are fleshed out. I already know what they are in the first hour of meeting the client. Always. And that's why I resolved, I think, every case I've done within 65 days of meeting the client completely, because I already know in the first hour what I'm going to do. And I can tell you, if I know it, I would think that the courts do, because they're more intelligent than I am. So they should be able to flesh these issues out quicker.
Thank you. That's
Thank
good to
you.
hear about parenting plans.
Yes, sir.
I see no more questions, and I have no more pink cards, so thank you for coming, Counselor.
Thank you.
And I will close the hearing on House Bill 471. And
I'll open the hearing on House Bill 438 FN and call Mr. Chairman, Representative Pearson, to introduce his bill.
thank you, Mr. Chairman. This bill simply wants to ensure that a youngster is represented with a friend companion when testifying or being deposed. If you look at the bill, you will see that there are advocate employees who help out, but that's not the same as having a buddy there. We have come to learn the value of having companion animals. They're very, very important for numbers of people. I think we can understand having a companion person when a child is scared because this child has to give testimony. I'm in my 48th year of ordained ministry, and on many occasions I've been present in the back of a courtroom when a youngster had to give testimony. In some cases, I was the companion person that child wanted to be next to him or her. And I can tell you, it's scary. If you've ever been deposed, if you've ever given testimony, it's a scary thing. Imagine how scary it is for a child. To have a friend next to you can alleviate some of the fear. One question that one may consider is, what if the child picks a bad egg and that person sitting next to the child is signaling to others who are giving testimony? The judge has discretion to throw anybody out of court who's misbehaving. So in the very unlikely event, I think, that there would be such a person wrongly chosen to be the friend, I think the judge could deal with that if the judge saw this was taking place. So I encourage this committee to pass this bill, and I'll be happy to take questions.
Are there any questions? Representative DeSimone.
Thank you, Mr. Vice Chair, and thank you, Mr. Chairman, for taking my question. You're talking about children in your testimony, and I don't see anywhere in the bill that it discusses children. Is there a reason for that?
Yeah, but not a good one. Broaden it to anyone. Because this is children and family law, I got on that track in my mind. I'm thinking they may particularly need a companion, but you are quite right. Anyone could need a companion. So thank you for improving my testimony.
No, thank you for helping me to understand. Thank you.
Representative Raymond?
Thank you. Will there be any restrictions on age of the individual that the child or victim chooses as their support person? And would like a support or therapeutic animal also be allowed under this bill?
I don't see any age restriction on this, and I don't see the mention of an animal one way or the other. That would fall under existing law where support animals may be mandated under various federal and state legislation.
One quick follow-up.
Sure.
Are you anticipating any training or otherwise support for this support individual so that they understand what their role would be in the courtroom?
I wasn't, but it sounds like a pretty good idea that if you're going to come to court to be that, you should know how to behave. I managed to get to be age 73 before I was deposed. And you'd think I'd know by now. I've watched 21 years of Law and Order. I'm an expert.
It's not
But
the
in
same.
point of but in point of fact, I was given some instruction before the deposition, and I would assume that anyone who came to testify would be given instruction by that person's lawyer, and I would assume a companion would as well. That's just how things flow.
Representative Grossman?
Thank you, Mr. Chairman. So my question is related to children versus adults. I was a support person for someone in their domestic violence case in which they asked the judge if I could be there. Initially, so for children, absolutely. However, do you think it could potentially be contentious for those that are adults, even though I believe it's a helpful thing to have in the court system? I just wouldn't want this to become another contentious piece in a situation where there's domestic violence or control issues of having that person bring someone to court, because this is applying to everyone, right?
Right. Again, if it looks like somebody is signaling, whether they're from the back or sitting past the bar, or causing a disruption, or clearly is ganging up, I'm sure the judge would take care of that because they already have when there's disruptive people behind the bar. So I would assume that this would continue.
Thank you. Representative Nelson?
Thank you, Mr. Vice Chairman, and thank you, Mr. Chairman, for taking my question. Do we have precedent in criminal court? Are there any people who are the correct terminology, it would be a support person. Sorry about that. Are there support people allowed in criminal court cases? Do you know?
I do not know that, but I know that Attorney Head has turned in a pink card, so he might be able to address that.
Thank you.
I was a support person in a criminal case to someone in one state, an adult in another state to a child.
Any further questions? Thank you, Representative. I'll call Attorney Richard Head.
Thank you, Mr. Chairman, members of the committee. My name is Richard Head. I'm the Government Affairs Coordinator for the Judicial Branch. I'm here to testify with some concerns about the bill as written, and I would be happy to work with the chairman and the sponsor and the committee if changes are appropriate. The bill as written would allow any party in any family court proceeding under 173B to be permitted a support person and says explicitly such use of a support person shall not be denied by the presiding judge. At least that language as written, I think, has the potential to create additional litigation and additional conflict, because if, as the sponsor suggested, the court tries to control the courtroom, if there's disruptive behavior, if there is an attempt to try to guide a witness in terms of their testimony, I think you're going to see that language as being used in an effort to retain the position of the support person. I think the issue of domestic violence and control issues is a significant potential problem. And again, the bill as written says the judge has no discretion essentially in allowing that support person in. If there's a potential for intimidation from the support person, if the support person is not truly there to support, but is there as a strategic move by a party, we would not, as the court, necessarily be aware of that, and again, we would not have discretion. Simply saying that a person is a support person, I think, would trigger the statute. We don't know anything about that person. We don't know the relationship. We don't know sort of how it is they're there to support, why they're there to support. It simply says, the court, you must allow it. I think the potential for additional conflict, additional problems, additional disruption, and potential additional control issues is significant in the way that this bill is written. One thing I guess I would say, though, is to the extent there, let me take a step back. I think judges in general, if there is a request to have a support person at the council table or at a proceeding, the court would at least listen to why it is that that's appropriate and how it's appropriate and how it would not interfere with the proceedings. If there is a concern or if there's experience by judges saying, we can't allow you past the bar, essentially the rail, there would certainly be nothing wrong with legislation that says the court in its discretion may allow a support person to sit with the party. Once you allow and in fact mandate touching, you can use touching as a way of signaling testimony. You can use that as a way of signaling in a way that the judge may not even recognize is happening because it may not be visible. I think there are a lot of variables that this bill, at least as written, does not take into account and just creates a absolute right of a party, any party, and an absolute sort of prohibition against the judge from restricting that. So all that said, I'd be happy to work with the sponsor and the committee if there is additional language or if there's another way of presenting this. But I think as written, it creates such significant barriers for the court to control the courtroom, the proceeding, and the way in which the parties are interacting, that we would not support it as written. With that, I conclude my comments, but be happy to take any questions.
Any questions, Representative Bickford?
In the first paragraph, in the first paragraph, the preface, the findings, it talks about the what we call the coalition being there for people, and so this is sort of looking back to them and saying, well, they're doing it, so why can't we? And I'm not sure to what extent they're allowed to do that. Does someone have to be actually a victim, no, not a victim, but proven that they've been a victim, or do they make a claim that they are?
So I guess I would leave it to the coalition and the folks who are involved in sort of matching people. We would, as a court, upon the filing of a domestic violence petition, give them resources to contact and try to have the advocates assigned. But in terms of the details, I would leave it to the advocate groups to describe that process.
Sure.
No, that's the answer I'm looking for. It just takes a filing. It doesn't take a conviction or any finding. It's just a filing, right?
A referral from us is the filing. What, in terms of the process beyond that, I would not comment on it.
Okay, thank you.
Any further questions? Seeing none, thank you, Mr. Head.
Thank you very much.
I'll call Lynn Cholet with the NHCA DSB.
All right. Good morning, Mr. Chairman, members of the committee. My name is Lynn Chalette, and I'm the Executive Director of the New Hampshire Coalition Against Domestic and Sexual Violence. The coalition is the umbrella organization for 12 community-based crisis centers throughout the state of New Hampshire that provide free and confidential services to approximately 15,000 victims of sexual assault, domestic violence, and human trafficking every year. I'm here to speak in opposition to House Bill 438, but also to suggest an alternate way that perhaps the sponsor's goal with this bill could be achieved. We very much appreciate the intent of this legislation in ensuring that victims receive the support they need after experiencing abuse. However, there are two specific points we would like to address. The first relates to the introduction of the bill. Should the committee move forward with this bill, we would ask that you remove Section 1, which references NHCA DSV advocate employees, because it is not accurate. The coalition does not employ any advocates who provide direct services to victims. Those crisis center advocates are hired and trained and employed by the individual community-based crisis centers throughout the state, and they provide critical life-saving services to victims, including safety planning 24 hours a day around the year. To the point that was raised earlier, advocates receive extensive training. In fact, it's mandated by statute that they receive a 30-hour training course, and the content of that is very specifically dictated. In that way, those advocates are able to help victims navigate the family court process. The second concern I'd like to raise is I don't think the statute is the right place to address this issue. There are protocols in place, which have been in place for over 20 years in the state of New Hampshire, through the family and district divisions of the circuit court, to be used in domestic violence cases. These protocols were developed with wide input from a multidisciplinary group of professionals who are part of the court process in family law cases. The protocols reflect best practices in the courtroom, and they're regularly updated to ensure that they are in compliance with both state and federal law. Moreover, as the other witnesses have referenced, these protocols were intentionally designed with victim safety in mind. Unfortunately, as we know, one of the most dangerous times for victims is when they seek to leave an abusive relationship. For that reason, a trained advocate is able to provide options and information and resources at this very risky time. Currently, these protocols allow a victim of domestic violence to have a trained crisis center advocate present with them during a protective order hearing. However, these protocols are not in law, and therefore advocates don't currently have a statutory authority to attend a hearing with a victim. And I'd like to share some specific language from the protocol. The protocol section 7-7 provides that if the plaintiff is accompanied by an advocate, the advocate should be allowed at counsel table and may be allowed limited participation in the proceedings at the request of the plaintiff. So some of the questions you've been raising about the parameters of the role of that person are already defined in this protocol. And even when advocates are present in the courtroom, the protocol has specific limitations when it comes to the scope of their role in working with the victim. As I mentioned previously, these protocols are routinely updated and in fact are undergoing a revision right now. So I would suggest to you that that revisionary process would be the appropriate place for a dialogue if the scope of a support person for a victim of domestic violence is going to change. There's already a document. It's being used by the courts, court personnel, judges, crisis centers throughout the state. So in conclusion, we would ask the committee to vote ITL on this bill. We agree with the bill's sponsor that victims should be allowed to have critical support during protective order hearings. However, that authority is granted by the court protocols and not in state law. So thank you very much, and I'm happy to take any questions.
I have one, if I may. Would you be satisfied with a carve-out for domestic violence if you already have it in rules?
Are you, thank you for the question, Representative.
That anybody else could get a support person.
Except for a domestic violence victim?
Because that's already been worked out with the court system, is what I'm hearing.
I'd have to think through that a little. It strikes me that would be hard to administer because this is talking about family law cases, but also sexual assault victims have access to advocates
Okay.
and trafficking victims. I think we'd have to think through that. Might take a little longer to answer that question.
Okay, thank you. Any further questions? Representative Bickford?
Thank you, Mr. Chairman. Again, at what level does someone come in, be called a victim? Can it be just on a claim, or does it have to be a finding before they get that kind of support?
Thank you for the question. I'm actually glad you brought it up again. So there are a variety of ways that people reach crisis centers to seek support. Sometimes someone who was raped or battered just picks up the hotline or walks in the front door. As Attorney Head said, sometimes they show up at the courthouse and the referral is made by the court staff. We also get referrals from a variety of other professionals, law enforcement in particular, but there's no factual showing that has to be made for someone to get help at a crisis center. They just have to come in and say, I need help.
Follow up. I'm not talking about crisis center. I'm talking now about having someone in court with them in the family court, as this bill is about.
Well, in this case, they would be a party in the family law proceeding. So yes, the proceeding is going on. It has not concluded. Has not necessarily been a certain finding, but my reading of the language is that that anyone in a family court proceeding, an adult or a child, would have the right to this if they wanted to.
I'm talking about your organization. The first paragraph.
Okay.
So it does not require a finding before you get help from the coalition.
Absolutely correct. In fact, the vast majority of victims that we serve do not engage in the criminal legal system or the family system. They're never in a courtroom at all.
Thank you.
Further questions? Seeing none, thank you.
Thank you very much, Representative. I'll leave copies of our written testimony.
Okay, great. I'll call up the Honorable Betty Gay.
Thank you. In no particular order, I will address many issues that have been brought up. This is the second time to bring this proposed bill up. So I've heard the arguments before. I was a little puzzled as to that they thought this needed an FN, because I don't think it costs the court anything to have someone stand with you when you testify. Other states that authorize a support person do clarify that that's what a support person does. They don't do anything else. They just stand there with them wherever the person who asks for the support requests, whether that's sitting where they can see them, or whether it's standing right with them, or whether it's touching them. One of the counselors in Salem had a client who had been severely beaten by a partner, and she got brave enough to testify and bring charges. But when she was face to face with this person who had assaulted her so seriously, she was terrified. So I think we would say that was PTSD. In the courts, by federal law, a victim of PTSD can have a dog, and we all know that you don't just go get a dog, that has to be prescribed and recognized that you deserve to get a dog, and then you have to spend or get some people to help you spend a lot of money to get a dog. So when a person is a victim of a crime, whether it's personal nature or whether it's a stranger, they can still have the same PTSD. And that doesn't mean that they have time to recognize that they need a dog, or they have the opportunity to get one, probably hoping that they won't need this forever. But court can come up pretty quickly, and we've done our best to help victims be brave enough to press charges. But when they get to court and suddenly their gut instinct is to be scared to death, to be in the presence of the attacker, it's understandable. And sadly, one of the cases I know of, even though they had all kind of proof, against the,
Representative, you're a little off track. I'm kind of losing
well, what I'm
the
trying to
intent of
say
this
is
bill in your
that,
conversation.
let's see, maybe I've wandered off on dogs. The point is, when a person is in court and scared, very deeply frightened of the person that they're trying to testify against, they should have the same kind of support somebody who's been given a dog can have. And which is, you know, a federally allowed program, and any place you can go in court, that dog can go with you. I verified that because last year one of the criticisms leveled at me by a former judge, no less, was, well, we don't let dogs in the court either. And boy, was he wrong. This law does not say that you have to prove that you are a victim. That hasn't been proved yet. You have to go through court to prove that there was a victim and there was an attacker. So you can't make that a criteria to get a support person because you haven't proven that it even happened yet. And if you don't, what happened in the case before that I referred to, the person walked scot-free because the judge insisted that not only the evidence, but the person, he demanded that the victim testify, and she just couldn't. That is, obviously the wording does need to be changed where it says that an advocate, an NHCA DSV advocate would be the person. I'm under the impression that all the crisis centers are linked together and members of the NHCA DSV. The advocate is very valuable, and in the case that I'm referring to, the advocate was present and had been very helpful. But there is no way an advocate that you've met to help you is the same as a deeply, strongly related person that is an emotional support for you. So we're not advocating against advocates. We're just saying they can't fulfill this need. Excuse me. I do have a handout that shows, you know, the proof that support animals are guaranteed access, and I think that people deserve the same who don't have an animal.
Thank you. Any questions, Representative Nelson?
Thank you, Mr. Vice Chair, and thank you, Honorable Gay, for taking my question. I'm a little confused because it seems to me that the example that you're giving is a person testifying in a criminal case.
May I address? Well, sadly, the lines get blurred in family court. So there can be some real criminal activities being discussed there. Thank
Follow-up?
you.
Oh, you good? Any further questions? Seeing none, thank you for your testimony.
Thank you.
Seeing no more cards, I'll close the hearing. You have to be back here at 1?
Straggle in a little bit around 1.
Okay. You go, Peter. No, this was for, yeah, Betty's. Okay.
Never, ever again say, this is just a very simple little thing.
independent oversight by a judge to make that determination. But for the rest of the time, whether it's Harmony Montgomery's mom or somebody else who's asking for information from the department shouldn't be able to squash what records are being requested. And in section 170-G:8-A, right, which has to do with confidential records by the department, the commissioner is granted authority in 3 places to deal with this, right? And the third section is rules. So this addresses the 2 sections where the commissioner can just arbitrarily say this information won't be shared. We're seeing a growing number of cases where children, right, may have been abused, or are being abused, either way, right? And a parent's trying to find out what's going on, whether it's a contentious divorce battle, whether it's a separation that already happened, and one parent wants to know what's going on. The department's not sharing the information. And that's the root cause that needs to be solved. In no other place do we have effectively, to use the vernacular, right, the fox guarding the hen house. The information is there. The department creates the information, but the commissioner can turn around and say, this information that we found, we're not going to share. So this would open up that to making sure that there's an independent oversight committee, or in this case, the judicial branch, overseeing the record sharing, and then would allow the the department to share the information in a timely manner. That's it for the bill, the need. If there's any questions, please I'm willing to take them right now.
Any questions for the representative? Representative Raymond?
Thank you, Chairman, and thank you, Honorable Howell. Currently, the process is that a parent writes to the Division of Children, Youth, and Families and requests a copy of the record, but they have to wait until the case is closed, like that there's some outcome to it. They're not getting in progress notes. Is that correct?
So the parent does in fact have to request the records. I don't know whether there's rules about disclosure during some court level thing. For the record, right? Our family actually was accused by DCYF of neglect. The judge ultimately found that we were very good, loving parents, and there was no evidence of any type of any neglect of our family. But it took a fair amount of time to go through the court to get the records, as opposed to going directly to DCYF. I couldn't request the records to DCYF. I ended up having to go through their legal team to get the records, right, on kind of as a court discovery. But that was already into the process of the court. So for that, when you're in the court system, there may be other rules about discovery on how records are shared. But if we haven't gotten there, why can't a parent have access to the records, right? Let's say, I'll use a hypothetical. A child's in school, comes home with a pretty nasty bruise. Parent wants to know what happened. Someone at the school makes a phone call to DCYF. That child is now taken in for a medical examination. Where did this bruise come from, right? Was this done at school? Was this done on sports? Or was this done at home type thing? Why can't the parent have access to those records? Right? We shouldn't allow the commissioner just to turn around and say, no, we're going to withhold sharing that information.
Okay. Follow up if I may. Thank you. Thank you. And thank you for your personal disclosure. That was very thoughtful of you to share that with us. In this particular case, you're asking that instead of writing to the local office and saying, I would like a copy of my family's record with DCYF, you would like, that's still the process, but then you want DCYF to have to demonstrate to a judge if they say no?
Instead of the commissioner just saying, no, we're not going to share the information, and we're aware of cases where that has happened, the commissioner would have to petition the court for the ability to not share that information.
No. What's the recourse now if someone were to be denied access by the commissioner? Is there, like, do they go to the ombudsman? Where do they go after that?
It's not real clear. It's a great question. Thank you. It's not real clear what happens when someone is denied information. Do they have to go to the court to order this, right? The process gets really muddy very quickly. in no other case is government creating records and then not sharing them, okay, where that same department gets to say, no, we're not going to share them, right? Typically, it goes to the judicial branch for the sole purpose of being able to have an independent oversight, whether this is information that could put the child in further danger. And that's that should be the threshold, right? Is this in the best interest of the child disclosing this information? Well, the commissioner who has that information wouldn't necessarily be an unbiased person to make that claim. The judge would.
Okay. Thank you. I appreciate it.
Representative DeSimone.
Thank you, Mr. Chairman. And thank you for taking my question.
Sure.
I'm reading section 1.
Mm-hmm.
And it says, parenthesis, open and close parentheses A, the department shall provide access to the case records to the following persons unless the commissioner or designee petitions the court, but there's no list of persons. What persons?
Okay, so you would have to go back to the rest of that section of statute. There's a list of people already laid out in.
May I follow up?
Yeah.
May I suggest that they be listed here as well, because it doesn't seem like the thought was finished, is my point.
There is the case records of the department shall be confidential. The record shall be available there's a list of people further down in this section, and I want to find it, right? Already laid out. So this is not the complete section of 170G8-A, right? It would be 2 pages worth of text. This is just 2 sections of that text. I can ask that the committee researcher, I can send it to you in.
I'm sorry, may I?
Yeah, go ahead.
I can get that. My thought is that the sentence just was not finished.
Okay.
And that's my concern. I would prefer it to be more clear.
Okay.
Thank you.
Thank you. So under 2 parentheses A, there is parentheses 1 through 9 below that. The child, the parent, the guardian, the custody, right? Another member of the family, employees of the department, legal counsel for DCYF. There's a whole list of people that are part of who records are disclosed to that's already past that colon. So the colon is the end of this sentence, but there's an entire list of people, and in some cases, organizations below that have access to the records.
Let me read that from the book here. The case records of the department shall be confidential. Sub A. The department shall provide access to the case records to the following persons, and parents are listed into sub 2, unless the commissioner or designee determines that the harm to the child named in the case record resulting from the disclosure outweighs the need for the disclosure. So if the commissioner or one assigned believes that releasing the records would harm the child, they shall not be released. That's what we have.
That is
status quo.
currently today.
That is status quo here.
So in this case, we have the executive branch, or a supporting function of the executive branch who's tasked with administering the justice side of things and enacting and administering the policy, who finds and produces the records. The problem is they also get the say on whether they're released or not. And normally the judicial process would kick in then about an independent oversight for record release.
So in other words, if we say you're not going to get them, you're not going to get them, you would like that to be changed to, if we want them, we get them unless you prove otherwise. It's a more.
Let me reiterate that slightly different.
Yeah, okay.
If a parent or the child or the list of 1 through 9 request the records shall be handed out. If the commissioner or designee believes that these are in fact dangerous to the best interest of the child or could cause harm, the the commissioner designee can then say to the court, I have a reason, I have good evidence why these records should not go out right now, and I would like a judge to confirm that. And then the judge gets to look at that evidence independently to make sure that there could be no possible harm to a child.
Got it. Representative Gregg.
Thank you, Mr. Chairman. Thank you for being here in your testimony today and for taking my question. The one question I have is what, my brain just totally like stalled out on me. What would be the reasoning that the parent, if this is in a case like, in somebody's case where they're trying to either look and see if there is findings for abuse or not, what would be the reason that the parent would have to have this report before, seemingly the entire investigation is done?
So I'm going to use since it was front page news, the case study about Harmony Montgomery along the way, right? Where the mom had numerous requests into the department for updates, what's going on. That information wasn't being shared. This went on for a very long period of time. And unfortunately, the lack of action in some cases would have been obvious if you had had the records, right? Would have been something that she could have then escalated the issue. I think in terms of transparency, we want to make sure the department's doing the best possible job. And the way to make sure that's happening is people who care about the children, right? And there's a list of 1 through 9 that would be people and groups and organizations that care about the children can get access to the records. The current system incentivizes if there's a problem, oh, we messed up, we don't want to share that information. And I'm not saying the department does that, but it wouldn't, the current structure actually could allow for that to happen, because if there was a mistake, they wouldn't want to share it, as opposed to letting an independent group oversee it.
Representative Raymond.
Thank you, Mr. Chairman, for indulging me. The questioning has led to another question popping in my head. And that is there a way to address the goal of this, which is to have oversight of the answer no, through some other mechanism, such as an appeals process for someone who's told no? If you request a record and and the commissioner says no, we don't want to release it because it's harmful or because the reports aren't ready or whatever the reason is. Is there, would it not be more efficient, instead of changing state law, to initiate a system within DCYF or within the Office of the Child Advocate or someone else to take a look at this and say, okay, I'm going to appeal this decision of the commissioner?
Thank you for the question. That is another way to address the same core issue, right? I think both processes that the one that's been proposed here and what you just talked about, are allowing an independent agency, in this case the judicial branch, or maybe it's the Child Advocate Office, to do the review. And it only questions who prompts that action, whether it's the department saying, I have information that we believe that this information in this document here, if released, would further harm the child, right? Versus the parent saying, well, I was just denied, right, routinely, I'm now going to appeal it. Either way, there's going to be that presentation before the judicial branch. And I think in most cases, the bulk of these are the information should be shared. There needs to be some judicial carve out that allows for the commissioner or designee to say, hey, I have a concern. If it's a sexual abuse case or something, there's certain information here that we don't want shared for some reason. We believe that this is going to create further harm to the child. We want the judge to rule in this case. So both are acceptable process. This is just one way to solve it.
Representative Nelson.
Thank you, Mr. Chairman, and thank you for taking my question. My question is just, are there any time frames or time guidelines or I'm just a little bit concerned about delays in being provided the information.
So there are time frames in this section of statute, hold on. I believe it's 30 days and 60 days. There are some timeframes in statutes. I need to go back and get you that answer, how that applies. This section of statute I don't believe has a timeline driving disclosure of records, and maybe that's something that should be addressed.
Can I just follow up? Thank you. And I guess also, thank you, because I quickly scanned it and I couldn't find it, so I appreciate that.
Okay.
But also too, would you consider a time frame for the petition and a time frame for a decision on the stay? Like, so my question is, can document disclosure be delayed because of a backup in the court system, and how could you prevent that from happening?
So theoretically, it is possible, right, that the court system could, right, because they have their own schedule and scheduling of a hearing. This might not, the reason I did it this way is if the department's the one saying these records are so important and would potentially damage the child, they can go directly to the judge. It would be a lot easier than scheduling it the other way, where the petition, the family starts the request. Now you have to schedule a court hearing. There's a bunch of other things that happens, making it even more difficult time-wise. If an independent judge turns around, looks at the records and says, yes, I could see the argument why the commissioner doesn't want to release these need to stay confidential. That might kick off an appeal process to Representative Raymond's question or earlier comment about, do we need an appeal process? I didn't get into the nitty gritty in terms of the details. What I saw, though, the fundamental problem that needs to be solved is we have the same department overseeing their work, being the one who gets the ultimate authority whether their work should ever be disclosed, and we should do our best job protecting the children. And if that is the goal of us as a state, it would be wise to make sure that if there's ever a failure to act, maybe, or an overreaction, maybe, a misdiagnosis, something, all of that information is available and that it has an independent oversight group. I will take and get back to you, Representative Nelson, on time frame. I got to go through. It's been a couple years since I've actually read through all of 170.
Thank you, appreciate it.
Any further questions for the representative? Representative Bickford?
Thank you, Mr. Chairman. My concern with this is it looks like DCYF will go to the court and ask them if they can not give it out, but the parent that wants it is not there. So it's kind of a one-sided affair, which is kind of unusual in a court setting.
So thank you for the question. It's a great question. That goes to, should there be an appeal process? The first review could be a judicial review of this information. And if the parent then believes that that judicial review wasn't done correctly, then you could kick off some sort of appeal in the court system where the parent says, well, the judge looked at it and they came up with the same conclusion. But I've got to believe that the judge looking at this is supposed to be fair and impartial, that if the information is truly that dangerous to release, that the judicial review would be pretty simple.
Follow up?
But DCYF has got their ear. They're the ones that are going there and saying,
I get
oh,
it.
by the way,
it's a step in the right direction. Does it solve every case? Maybe not, right? But at least we have the chance that there's an independent review. Today, there is no independent review. The same agency producing the information gets to say, well, trust me, I have this, and it's really damaging to the child, but I'm not going to show you what's here because I've decided to keep it hidden. That type of thing doesn't work in our society in terms of openness and transparency. That's why I said this should be a reasonably nonpartisan issue to make sure that when there is information that's available, that it be given to the list of nine people in groups, and only in the rare case where it would be harmful to the child would it be kept confidential, and only when there's a judicial review to make that happen.
Thank you.
Thank you, Representative. Seeing no more questions, the chair recognizes Beth, it looks like Morgan from DCYF. Are you Beth Morgan?
Not Chair, I am Beth Margison. I'm sorry, I have very bad handwriting.
So you're going to be Beth Morgison on all of these cards you filled out, right?
Yes, I am. All
Good.
day, I'm going to be Beth Margison.
Okay, the part of Beth Morgan is now played by Beth Morgison. Thank you. Oh, you did it. Okay, no, sorry.
Okay, so thank you, Chair and Vice Chair, and the members of the committee for the opportunity to speak here today on this bill. I just wanted to give the committee some background, just sort of starting from going back and then forward. 170 G8A requires the division to produce all records to the people. Representative Houle is exactly right. There are 9 entities to which records can be released. The exemptions from those records are things like third-party records, doctor's records, school records, things that are submitted to courts. I forget what the other exemptions are. There is no exemption for the division to not divulge information that might be damaging to it. We do not withhold that. Those go, whatever is in the case file that we have to furnish to any of those entities goes out. The time frame for producing those records is 60 days. However, the division is very behind on records requests because we have been trying to set up a records request unit for years in order to facilitate and expedite records to individuals whose right it is to have those records. And we feel very strongly about getting those records to them. As to the legislation itself, the division does not withhold records unless there is an open assessment going on or a concurrent criminal investigation at the request of the police. When a criminal investigation or an assessment is closed, then we are able to release records. That is the harm to the child. It's whether we need to make sure that the assessment is done without any kind of, I wouldn't say interference, but just making sure that the assessment is done by the division, and if there's any criminal investigation that is part of that, is sort of going alongside the assessment, then that's the only time that we actually withhold releasing records. So I have any questions if anyone like to would ask me some. This is a records request, but there are instances where the division is in court with a parent, and parents are actually provided discovery, and that is a fuller set of case records that does include third-party records. So that is that in that case, if the parent is court involved with DCYF, they do receive all of the records because it's discovery.
Let me read section B. After the 9 people mentioned, section B says, the department shall disclose information from case records or provide access to case records to the following persons or entities. I will jump down to sub 4, the person or entity with whom the child resides, if that person is not the child's parent, guardian, or custodian. Continues, if such information or access is not harmful to the child and is necessary in order to enable the person or entity to evaluate, provide services, and so on. I think the question that is begged is who determines harmful?
That is the commissioner. Harmful is an open assessment. In that case, I don't have the statute in front of me, but I believe 4s are foster parents, and we are allowed to release limit information to foster parents in order to help with the provision of services for children. And the key point in that statute is the department shall. It's mandatory. We have to do it.
The only block on you have to release is if in your determination to do so would to be harmful.
Yes.
So it's a positive push statement here. It's not an allowance. You must do it.
We must do it. It's the law.
Then I have a quandary because the bill before me, at least in my mind, seems to indicate this hasn't been done, at least in some instances, and the prime sponsor wishes to make something happen. So I'm not quite sure why we're here.
I don't either. I think that's probably a better question for the sponsor.
I'm going to ask him that in
Okay.
a minute when we're done asking you. I'll give him another bite at the apple.
Thank you.
Representative Raymond.
Thank you, and thank you so much, Ms. Morganson, for being here. You said that there's a bit of a delay happening on records requests, and I remember that from my time, well, although 5-10 years ago, that it took some time, but sometimes we had parents come in and read the file or whatever. Do you know what that delay is on average statewide?
I don't.
Okay.
I don't. It's but I think we're past the 60 days. I just know that we have, the attorneys have to do the review of the records before they're sent out to make sure that those other records are not included in it. We're short-staffed in the legal services right now, so.
And then follow-up regarding.
Follow-up.
Thank you so much. Regarding open assessments and open concurrent police investigations, I recall that a number of cases have concurrent police investigations, and there's, at least in Nashua, there was a high level of cooperation between the police and DCYF. What would happen if DCYF were to release records while there's a police investigation?
I don't know if you can say generally what would happen. I think everything's on a case-by-case basis. I mean, again, I don't want to generalize because I don't know the full landscape here, but I think it would be unlikely that the division would actually release records while there was a criminal investigation ongoing.
Okay, thank you.
Representative Long.
Thank you, Mr. Chairman. A couple of questions, if I may, following Representative Raymond's question. Would you assume that the update of investigations would also be released, or would that be another request? If this were to pass and you would be required to give that information?
Well, as I understand it, we would have to petition the court to make an independent verification as to whether or not we can release the records.
Okay, and if it were released, would updated investigations be required, in your opinion, or would any update would have to go back to court?
Well, generally, when we do records requests, we generally include all the information. Sometimes parents will say this referral, but we'll find out that there's other records or some, and we generally will include all the records. We have 11 district offices, and oftentimes we will have cases that go across all the district offices. And so we have a policy in our office that whatever office gets the request has to gather all other requests from other district offices.
And a follow-up, if I may, Mr. Chairman? Thank you. So a physical health entity would get this information. Are there deductions? For example, if the child had a psychological evaluation, would the physical health doctor get that?
That would be for a child generally. I don't have the statute in front of me. That would be for a child who is in our custody or we have perhaps legal supervision for, and we're trying to provide services for them. We would give limited information to that doctor to provide services. When we're doing just a records request, I know this is a little confusing. There was no case, the assessment closed, we hand it over generally to the parents. If we do have information from a medical provider, we can't release that under this current statute, but what we do is we provide the parent with the name, address, the information that they would need so that they could go get that information. Generally, it's from their own child's pediatrician, so they generally are able to get it.
Okay, thank you.
Thank you very much. I would like to call Representative Holback because I do have this conundrum here that given Section B of 170G8, that the department shall disclose information, what in your consideration necessitated this bill, Representative?
Thank you for the question. So case study of one, I hate case studies of a one. I'm an engineer. I like looking at larger data sets than one. So maybe our family was the anomaly, and the other 99.9999% of families that have experienced an interaction with DCYF have never had any issues getting information from the department. I thought this would be pretty simple. The statute was pretty obvious, right? I should be able to request the information. It was withheld in our case. And in talking with some other families, I'm now understanding that there's a reluctance to share the information that the department has. So yes, it says shall, but there's a carve out that allows the department today to turn around and say, we're going to ignore the shall because we can, via the commissioner's office, determining that this is not right, determines, right? That's the word that's in statute, determines that this could harm the child. But there's no metric, no standard for the word determines there, and there's no independent oversight. I don't see how we do this in other branches. When there's a decision-making body in other branches and someone says that's not fair, we typically kick it over to the judicial branch for an independent evaluation.
Representative, it goes back to my question under 170G8A, B, that the department shall disclose unless, and it's the unless, is not harmful to the child. And that begs the question as to what constitutes that and who makes that decision. So it is the people making the decisions themselves without independent review. Am I tracking with you here?
Yes.
Okay. Anything you want to add?
I think I'm all set.
Okay, good. Thank you. And that's it in terms of pink cards, and don't run away because we're going to start something else. This ends the hearing on whatever we are having a hearing on, 497? 497. And now we open the hearing on what's next. And I'm all over the place here. 535, open the hearing on HB 535 and Representative Hall.
Thank you, Chairman, members of Children and Family Law. For the record, Representative Hall, Dunbarton, former member of Children and Family Law, about a decade ago. The bill before you has to do with whether a child, and child in our statutes is everybody from 0 through 18, and I will come back to that point, is entitled to have their view represented in court. I believe the committee researcher has turned in a packet that looks like this that you guys were given. I would like to see if I can get the electronic copy of this. Yes, that packet. I would like you to flip to this chart here.
Page.
I don't know, about 4.
4.
There's a large
Well,
map of
it's,
the U.S.
It's another page 4, because there's several page 4s.
It's the 4th piece of paper or 5th piece of paper or so in the packet.
Thank you.
I discovered the issue that this bill tries to address through our interesting court escapade last year. In that case, we had a teenager who wanted to have their own view shared in the courtroom, and that wasn't allowed. And I said, well, wait a minute. So we ended up hiring an attorney for him. That was the easiest way to take care of it. We hired an attorney, we paid the bills, and he got to go talk to the attorney, and the attorney showed up in court on our behalf, or on our son's behalf. But I found out in speaking with this attorney and others that we're one of the few states that does not allow children to have representation in court. They're apparently considered a substandard class of citizens, and I think that's offensive. Okay? A 15-year-old is very capable of sharing how they feel about what's going on in matters involving their life. Why can't they get access to counsel? Well, they can't pay for it. Well, how do we deal with that with the rest of society? If the person can't pay for counsel, we at the state level provide counsel for them. Now, this is different for a 2-year-old. I understand that. But in this case, we don't, okay, we have CASA volunteers, we appoint GALs, but there is no one who is actually arguing on behalf of the child's wishes themselves. The CASA can do their best job, but they're not obligated to represent the child's wishes. They're obligated by statute today to represent what they think is the best interest of the child. So in this case, the child is really without any counsel. And then the one place that it does show up in our statutes is at the dispositional hearing Well, we're pretty far down the process. And if this is a reassignment from a family to a foster family or from one parent to another, there could be a lot of situations the child really doesn't get any say. They just get shoved around. And I don't think that's fair. So the issue here is a lot of states have started to go down the process where the child is entitled to legal counsel to represent their wishes. We don't do that. Even Massachusetts does that. I would argue that the best thing we could do, and maybe it's not for all ages. I can have that conversation, right? There's a big difference between a 5-year-old and a 15-year-old in terms of being able to represent their views and understanding what's going on. But by the time we get to a teenager, they should have their say. They should be allowed to discuss what's going on and how it impacts their lives. Because no matter what happens at the end of the day, the decisions that the court is making, the decisions that all the other interested parties are making, affects them significantly. So they should have their say in court. That's it.
Thank you for your presentation. I have a question here in section Roman 2.
Yep.
After the strikeout, the court may appoint an attorney. Go down 4 more lines. In addition, the court may appoint an attorney. But then go down to the bottom of the page under 490D3A, shall be entitled to representation. How do you harmonize the court may do it with the court better do it?
So that's a great question. I'm sure I was not the only legislator who put in an LSR who in the week between Christmas and New Year saw various redrafts and whatever, and, oh, please sign off before we get this bill done. And I'm not blaming them. They had a huge number of requests. But this, I think we need to do a scrub of the languages to make sure the shalls and mays are in sync. In this case, the goal would be if the child shall be appointed counsel, and that may cost the state some money, but we should allow all citizens access to an attorney to represent their view in court.
So when you scrub the language and come back with an amendment, when we exec this, we could assume that the language the court may appoint will be moved to the court shall appoint.
Yes.
Also on page 2, it talks about fiscal notes. Again, it was a busy time.
Yep.
They were not ready. Has the fiscal note since come forward?
I have not seen the fiscal note. It is an FN bill. I'm sure it's going to finance because it would impact state spending. So that being the case, I'm sure it's coming to a second committee. This is probably an early bill.
It's not been given to me as an early bill, but I could assume they might change their mind. So given the possibility we may have to get it out the door by the middle of February, would you come back as soon as you could with an amendment to the language based on this and anything else that we might share at this
Absolutely.
point? Anybody else want to help him in his scrubbing project? Anybody like that idea? Scrubbing? Scrubbing we shall go. Representative Long.
Thank you, Mr. Chairman. You brought up a good point. Appointing an attorney for a 2-year-old. So should we define that what,
It's Representative Long, thank you. It's a great question. And there is a point where a child has enough capability to be able to make recommendations and understand what's going on. And a 2-year-old is not at the same place as a 12-year-old, right? There are some guidelines in other statutes about when children are allowed to testify in court, for instance. I believe that's 13 or 14. I have to go back and look at the statutes. There are some other things, but we can move the bar from 18 down. What the right threshold is clearly something worth debating, whether that's 16, 14, 12, 10, 8. 2 is probably at the other end of the spectrum, right? At that point, they're not capable of fully taking care of themselves. So a window that seems reasonable is somewhere between 8 and 14. I don't know what the right number is, but there is a point in time where children are cognizant of what's going on around them to make well-informed decisions in something that dramatically is going to impact their life.
very good, thank you.
Representative Raymond.
Thank you, Chairman, and thank you, Representative, for being here. Are you wanting the court to appoint or have the ability to appoint representation for the child prior to a disposition on a case? So currently, they get, if they're in foster care or whatever, they get a CASA, or, you know, a parent could get a JAL once there is a finding of abuse or neglect and a case is opened. But up to that point,
So-
the DCYF hasn't determined, the court hasn't determined abuse or neglect yet. So you're asking for representation to them before a case has started?
So my understanding of the process, having gone through it only once, I don't claim to be an expert yet, is there is a preliminary hearing, and then there's an adjudicatory hearing, and then there is a dispositional hearing.
Yes.
Clearly, by the adjudicatory hearing, the child should have representation, because that's where the facts of what's going on are discussed, and the child may have information that would be relevant to the adjudication decision as opposed to just the dispositional. This is drafted all the way back to the preliminary hearing, because that's where, in our personal case, and I don't want the bill to be about our personal case, but that's where the case went off the rails significantly. Okay. And a little bit of additional information in that hearing would have been very different. So I think it's worthwhile that there at least be the door opened for at the preliminary hearing, but definitely move the bar back from dispositional to the adjudicatory phase.
And quick follow-up.
Follow up.
I'm 5 years out of date now with DCYF and CASA, so I apologize. But back when I was involved in DCYF and CASA, there was the youth in court protocols where children were invited to all of the court hearings. And I know that that was happening because I drove some myself and had an opportunity to speak to judge like pretty much whenever they want, or otherwise meaningfully participate by writing a letter, or I mean, we had 2-year-olds drawing pictures for the judge. Is that not happening now?
So my understanding, the rules are slightly different, and there is a provision, I believe it's 13, the DCYF worker, or we can find out from, with the committee researcher, but there is a threshold, and it's either 13 or 14 before the child is entitled to appear in court for the first time. So there's now a prohibition there. You can set up, and forgive me, I don't know the legal term, but an appearance with the judge directly. We actually petitioned for said thing. DCYF came back and said no, and it would be front page news if I used the language they said about their reasons. It was appalling. So allowing the child, they're a person. At the end of the day, we should protect the children in the state to the best of our ability. If a child says, I don't think this is fair, there's something wrong, I want to talk to the judge, we should make sure that happens in any way possible. And in our case, that couldn't happen. Rarely do you get to file a piece of legislation for a family member, but in this case, sorry, I'm a little emotional, I do, because I watched firsthand the trauma, that my child experienced through all of this, because he was denied access to the court.
Thank you.
Any further questions for the representative?
Thank you.
My suggestion is, since you have to go testify in another committee, that if driving home tonight, we get this brainstorm that begins with, oh, I should have asked him, would you welcome them to email or call you
Absolutely.
while you're undergoing your little bill scrubbing?
Absolutely.
So that
Please contact me.
we can add some of our wisdom. Okay, good. Thank you.
Thank you, everyone.
Chair recognizes, let's get the name right, Beth Morgensen. That's Norwegian, isn't it?
It's actually Scottish.
Well, I'm Scottish, and I know where a lot of my ancestors came from. It's from Norway, so
I am actually Norwegian. Margison is my husband's name,
Whoa.
but he is not Norwegian. So as I understand it, it's Scottish, but
We'll have to talk later.
exactly. So again, thank you, Chair, Vice Chair, and members of the committee for allowing me to speak here today. I am Beth Margison, either Norwegian or Scottish, and I am here on behalf of DCYF to provide testimony on this bill. A couple of things, just sort of working backwards again. Representative Houle is correct in that the children, or perhaps it was you, Representative Raymond, I'm not sure, but according to protocols that were developed between CASA and other people in the Model Court project, children 14 and above in the dispositional phase going forward can speak to the judge directly, and that can sometimes be off the record with their CASA present, tell the judge anything that they want to, or they can speak directly in open court. It's generally up to the judge to decide how he wants to take that testimony. And also, yes, children as young as 2 can send pictures and information to the judge to tell them how they're doing. I think the consensus was that 14 was probably the youngest age at which children, and it is important for children to have voice in court and proceedings, but that they had reached a sufficient maturity to speak in court at that age. And notably, the age of consent for adoption for a child is also 14 years. The division would have a lot of concerns about having a child present during an adjudicatory hearing. The division has never called a child to the witness in any kind of adjudicatory hearing. I remember one child was asked to testify and a judge would not allow it. Ultimately, who is allowed to speak in a courtroom is up to a judge. But in general, children do have a voice when they're over 14 years from the dispositional phase of the case on. As to the merits of the legislation, Representative Houle is right that New Hampshire is but one of a few states that do not have representation for children. The division is not necessarily opposed to that, not opposed to providing representation for children. Our concerns is that it would be extremely expensive. The pool of attorneys that would likely be able to work with children would be somewhat small, and there would be a lot of conflict with parents' attorneys, and that parents' attorneys would also be representing individuals in the same case, so you would probably see a lot of conflicts in interest. It would cost quite a bit of money. Again, we're not opposed to that. But we think that in terms of the money that we need to build up our system and improve it, at this time, that money probably would be better spent on assessment, treatment, and services for children. But it is correct, and as your committee researcher has noted in her materials, which I haven't had a chance to go through, we are but one of a few states that do not represent children, to have appoint attorneys for children. Another issue with the legislations as drafted is that where the child's express interest conflict with any recommendation, we're concerned that this could be potentially trivial things, which are big things to a child. Limitations on cell phone use, curfew use, that this could perhaps, first of all, it would probably certainly create more litigation, but that every single aspect of where the child wants to do something would become a lawsuit, basically. Not a lawsuit, but it would actually create litigation. It would prolong permanency. It would make for a very difficult case to handle going forward. Again, dispositional orders, the bigger portions of the case, the bigger parts of the case, placement, treatment services, psych evals, visitation with parents and whatnot, those are things that are routinely hashed out in court, not only at the dispositional hearing, but at the 3, 6, and 9-month hearings prior to getting to the permanency hearing. At that point, the child is represented by a GAL. The child does have a GAL or a CASA appointed to the child to represent their best interests. I think that's about all we have to say on the legislation. If I'm here to take any questions if anyone has them.
Representative Long.
Thank you, Mr. Chairman. Do you have a recommended age if this were to pass at what?
I I don't
6,
think you can put
13?
an age on it because I don't think other states have put an age on it. I think you either appoint attorneys for children or you don't.
All right, thanks.
Yes. Representative Ball.
Thank you, Mr. Chairman. A question about the CASA. Is it possible for the CASA to represent both issues? The issue of what the child would like versus the what the CASA would like, so that they could present both sides of the issue, because the CASA does spend a lot of time with the child, and I'm sure they've talked about what the child wants versus what the CASA feels would be in the child's best interest.
I'm a little reluctant to answer that because I don't represent CASA. In general, I will say CASA's here. Okay, good.
If I found a CASA over your left shoulder, nodding up and down, and she were to fill out a pink card, could we take her expert testimony?
I would defer to the expert testimony of
Okay.
CASA.
I was a CASA, just so you know.
Oh,
That's why
okay.
I'm asking, because it seems like it would have been a rather
Me CASA, si CASA.
yes. So, it just seems like then you wouldn't have that. You already have a CASA, but I would like to hear from the other person as well. It's been many years since I've been a
Yes, because
CASA.
then you'll get a real answer.
Stretch it out while she's filling out her card.
Okay. Any other questions? I think that's all I can do, Mr.
Well,
Chair.
you know, yeah, I can fill some time in. Given the fact a lot of states listed as doing this are states that we could call impecunious or stingy or frugal, they seem to have found the money to make it possible. So I wonder how much money this would actually cost after all.
I don't know. We don't have a fiscal note on the bill, so I really don't know.
Okay. The chair recognizes the person who is signing the pink card and is handing it to Representative Bickford, who is walking it up to me. And if we
I
could
will vacate the seat.
just momentarily.
Thank you, and I apologize.
We
for-
recognize Marcia Sink from Manchester to speak to the question.
Yes, thank you for the opportunity. I'm Marcia Sink. I'm the CEO of CASA of New Hampshire. And to fill in a couple of the blanks, there are court protocols that allow any child to attend court. And I just wanted to say that our judges are encouraging and inviting children to attend their court hearings. And it would be, as Attorney Martin represented, it is after the dispositional phase of the hearing. So it is during those review hearings when a child can be invited to attend the court hearing. Also, under the guardian ad litem rules, any GAL, whether it's a CASA or a paid GAL, is obligated to bring to the court's attention when the child's wishes are in direct conflict with their best interest. And we are required to do that under, again, the guardian ad litem rules. So there is that opportunity for the court to be made aware at any point in time what the child's what their wishes are. There is also the opportunity for the appointment of an attorney for those children if the court determines that it is necessary. So we have right now about 20 cases on our caseload, which our caseload right now is 639 active child abuse and neglect cases. There are about 20 cases right now on our caseload where there has been an attorney appointed for the child for a variety of reasons. And but that's at the request of typically of the CASA guardian ad litem or other guardian ad litem.
And yet, that being granted, we're colored white in this map, one of the few. So although, let's stipulate, all of those things are true, what could we do perhaps that we have not been doing in order to change our color on the map if we desired to?
Well, I think the resource issue is a huge issue for the state. The way this proposed legislation reads, the way I'm reading it, is that in fact, it's looking for an attorney appointment for every child who comes into the family court system, which is much broader than just those coming in under the 169C statute, which is just the abuse and neglect proceedings. So that opens up, number one, a huge door to other types of cases. Marital cases also are heard in the family court. So, but our caseload alone right now, we have over 1,000 children on our caseload, and again, this looks at appointing an attorney for every single child.
I beg to differ. The Section 2A of the bill before us, in cases involving a neglected or abused child.
Yes, it states that in the beginning, but I believe it further goes on to, but I could have misread it, and for that I apologize.
Maybe I am too, because down in 490D3A, in all proceedings in the Judicial Family Division, a
Right.
minor child who is the subject of such proceedings, which begs definition, so that may broaden it considerably, so we may have a conflict
Possibly,
there.
yeah.
I'll give him a call
So,
on that.
yeah.
Let's just say that that is not the case, and it's only in cases involving neglected or abused child. That should bring the number considerably down.
Correct. If in fact we have 639 open cases, but involved on all those open cases are over 1,000 children. So, and again, the way we're reading this is that it would be an attorney appointed for each of those individual children. And sometimes our sibling groups have very different needs and desires. The other thing I would say is that the first part, which in the Roman 2, the elimination of the appointment only being able to happen during after the dispositional orders, we would ask. I mean, what we would love to see is that broadened, that at any point, as they're suggesting here, that at any point during the proceeding, the request for an attorney could be made by the guardian ad litem.
So you would approve of the strike-throughs?
Yes.
Okay, thank you.
Yes.
Representative Levesque.
Thank you for taking my question.
She's taking your question.
Yeah.
Letting you.
With it's been mentioned before about kids sending in letters and drawings to the judges. Has that helped a lot when dealing with children's cases like in abuse and neglect, and helping figure out what's, especially for younger kids, like what's going on in their mind, and seeing that
It's
digital-
been remarkable, really, how I think one of the things that's been so powerful is the relationship then between the judge and the child, and how attending court hearing or writing the judge a letter sort of demystifies things for some of our kids. I could share a real quick little story. No. Yes? Oh, okay. So we had a 6-year-old little boy who was coming home to his foster home and asking his mom after school if he could watch Judge Judy on TV. This was a while ago. And foster mom kind of allowed him to do it for a couple of days and then said, wait a second, how about Sesame Street today? And he said, well, I want to look for Bob, my CASA volunteer, in the courtroom. And so the CASA made arrangements for the judge to meet the child and, played Beanie Babies or something on the floor with the child. But that demystification of, and for some of our older children who are given the opportunity to talk to a judge and they feel they've been disempowered by not being able to be present, finally can be there and feel like their voices are truly heard.
I'd draw the line at watching Night Court.
All right. Yeah, fine. I'm good with that too. Yeah.
It's back, by the way. Yeah. Have you talked to Representative Hall about this bill?
We have not.
I might suggest it would really kind of improve it if you would.
Okay.
I'm
We
not going to
can-
rat you out to him, so it's in the book of reps, and I think he's on to something here. And he told me over the lunch hour that it's a rough draft, and he invoked I'm going to scrub this provision. So I think this could really improve it.
And I think there are certain situations and certain types of cases where appointment for a child the division talked about 14 and older, or some of our children are youth that are in out of state placements. Sometimes their voices are ones that could really help and have an attorney who's advocating for them.
Representative DeSimone, is it for the CEO or for the attorney? Are you attorney too?
No.
Okay, good. The CEO, attorney. Which one?
I would like to ask the CEO a question.
Please do.
Isn't it true that the younger the child, the less apt they are to tell a lie?
Yeah.
I mean, do 2-year-olds know how to lie? Do 1-year-olds know how to lie?
I'm not a clinician, but I'd be hard pressed to, unless they've really been coached.
Follow up, please.
Yeah. I mean, yes, you may.
So,
Uh-oh.
as young as a child is, if they were to be appointed an attorney and have the assistance of a CASA, wouldn't it aid the court in determining abuse and neglect to the child even as young as a year old?
I'm not sure, I guess.
What I'm trying to get at, may I follow up?
Follow up.
What I'm trying to get at is we've had discussion and questions about age limitations.
Mm-hmm.
I'm not sure that I'm in tune with an age limitation, especially when it comes to abuse and neglect and the ability of a very young child to report what's happening to them in a variety of ways. They don't have to be able to verbalize, yes, this is what happened to me. They can do it by hand motions, pictures, whatever. Is that correct?
We don't do investigative work on our cases. That's really DCYF's job. So, and I'm not a clinician, so I'm sort of, it's kind of a murky area for me to be entertaining.
Thank you for
Sure.
trying.
Absolutely.
Representative Long.
Thank you, Mr. Chairman. Thank you for your testimony.
Sure.
Do you see any duplication of CASA specifically, not a guardian ad litem appointed, but a
Right.
CASA appointed guardian ad litem, or a possible conflict with an attorney of the child? Because you're the best interest of the child.
Right.
The attorney would be the best interest of the child.
Well-
Do you see where it may conflict?
Yeah, I guess that there is that possibility. I think if the attorney is appointed as counsel for, they're really sharing what the child wants. So which is can be very different from what the CASA would be representing as what's in their best interest.
Okay.
And I think there is that clear line in the sand that should be adhered to, but there may potentially be conflict, I would think.
Thank you.
And
Sure.
maybe that's part of the point here, is that Section 2, in cases involving where the child's expressed interests conflict with the recommendation of the guardian ad litem, you do have, by definition here, oppositional.
That's right. And that's when we're required under the guardian ad litem rules to share that with the court repeatedly if need be, too.
Anyone else? Representative McMahon.
Thank you, Mr. Chairman. Thank you, Ms. Sink. Do I get that right?
Yes.
Thank you. Two questions for you. We have received a report here, and it said what separates us as the chair, Chair McPherson Pearson stated, was that New Hampshire is not part of states that provide representation. But it says here in its statement, it says it doesn't guarantee the right to counsel, although we would have the option. Do you? My first question, based on that, is should we guarantee the right to counsel as part of this bill?
I would suggest that, well, I think as I said earlier, I don't think it's necessary on all cases. I do think at times there are certain types of cases where attorney representation, for example, we deal with immigration cases at times of children who are trying to get their green card. They need an attorney to help them through that process. So we've had pro bono support from some immigration attorneys to help that happen. But there are certain types of cases where I think legal representation for the child could be a valuable thing for them. But I wouldn't say all cases.
Understood. And one follow-up, Mr. Chairman? Thank you, sir. Specific to the bill, it's focusing on abuse and neglect by narrative. You referred to protocols for any child to attend court within your construct of how you do business. Is language that was it within the protocol? Should any of that be applicable or applied to the bill that is to be adjusted as the chair has recommended?
That's an interesting idea. I don't know if the division feels how they feel about that, but there may be, and I guess I never looked at it through that haven't looked at it through that lens of is there protocol that could be incorporated in this.
Just one final clarification. Thanks, Mr. Chairman. Could you provide what those protocols are? They in writing?
Yeah.
So I would love to be at the same intelligentsia level you are on that issue.
Sure.
So you can make an informed decision.
Sure. Yeah.
Provide
Happy
that
to share
the
those,
committee.
or I'm sure the court could share those as well. So they are a document that is used regularly.
And would you be prepared to share that with the committee?
Yes,
Okay,
absolutely.
good, thank you.
I think we have a member of the committee that has already found the materials we require, Your Honor.
They are.
That will not put you out of a job, however, the fact that she
No.
has done that.
Well, they are on the court website.
Yes, Miss Sink knows very well that I would never put her out of a job. But
Thank
yes,
you,
they're
Heather.
on the court website. If you just Google protocols relative to children and youth in court, New Hampshire, it goes through RSA 169C and all of the protocols.
Could you send that to me directly? So
Maybe.
Committee, send it to the committee, please.
it's under
Thank
appeal.
you.
I know, but I'll ask.
CFL at, okay. Thank you. Any other questions for the CEO? Thank you so much. Aren't you glad you came today?
I didn't expect to do this.
I'm glad
but
you came
well,
today.
Thank you all for the work you do. Thank you.
Counselor, come on back.
Yes.
She's back. Do you have any further questions?
Anybody has any further questions?
Representative DeSimone.
The question that I asked the CEO and could not be answered, I noticed you were smiling. Can you give us any insight on minor aged children testifying?
I was smiling because I'm also not a clinician. Minor age children do not testify. The information that about the child, whether it's abuse or neglect, comes in through the CPSW, who has conducted her assessment by talking to the child, the parents, and any other sort of collateral contact. So we do not allow children to testify in proceedings. And I would not want, the division would not be supportive of any change to the law that would require that children should participate in their cases. They do need a voice, but from the dispositional phase on, not to be involved with the fact finding surrounding what has happened to them. You had also asked about, and I'm not a clinician, so I'm going a little bit out on a limb here, but about whether or not children lie if they've been coached. Generally, the division cannot repeatedly question children. They will actually refer them to the Child Advocacy Center and also do forensic interviews of them. And I think this consensus is that a child who has been coached, that becomes somewhat apparent on a further interview, because they just, they I don't want to say this about kids, but they can't keep the story straight. It's when a child is consistent about an event to 2 or 3 different people, that is compelling. Again, we do not repeatedly question children about things that happen to them.
Thank you. That's what I was looking for. Thank you.
Thank you.
Any further questions? Thank you.
Thank
So
you.
much. You know, it's so hard to get good lutefisk in New Hampshire. You know what I mean? Yes. The chair. My wife almost fainted when I told her how it was made. Yeah. The chair recognizes Attorney Richard Head.
Thank you, Mr. Chairman. Thank you, members of the committee. Richard Head, Government Affairs Coordinator for the Judicial Branch. And I apologize, I did come in late, so I did not have an opportunity to hear the sponsor, and I apologize, I was testifying in another committee. We do, as written, have some concerns. We don't have any issues, and we're not providing any testimony on part one of the bill. There are two parts to this bill. Part one talks about the express conflict with, and adds any recommendation and deletes 4 dispositional orders. We have no input or testimony on that and don't have any concerns. Part two of the bill is a new section in RSA 490D, and there are some questions earlier about this being related to abuse and neglect. 490D is the statute that creates family division. So everything in family division is 490D. 490D just establishes that. So if, and we would appreciate if there was some narrowing of that so that there's a specific issue, abuse and neglect or what it may be, that it be placed in that section. 490D would suggest that every child in every family division case is entitled by a matter of right to a lawyer. The other aspect of the bill that as written is very unclear is it doesn't talk about how that lawyer is being brought to that child, how they're connecting, who's paying, how sort of a process. It's a new standalone sentence that has no particular connection to a court referral, a court order, and a payment source. So unsure in terms of what is intended there. We would have a great deal of concern if the parties were selecting, or a party was selecting a lawyer for a child where there's a significant opportunity to manipulate that child in the proceeding. So if a party is paying for the attorney and that party then has some form of relationship with the attorney, it creates significant issues in terms of the independence of that lawyer, the child, and within the proceeding. But as written, it's a simple standalone sentence that seems to be almost jurisdictional. It just says, if a lawyer appears for a child, the court has no right to interfere with that. And at that point, we have concerns just who's paying for that lawyer, what's the relationship of the lawyer to a party in the proceeding, or to someone outside of the parties, but who may still have a role in sort of affecting how that child is being presented. So just significant concerns as written. We're always happy to work with the sponsor, with the advocates in terms of additional language or changing or modifying the bill, but as written, we would suggest ITL, but that doesn't mean that there can't be changes that improve it. And we'd be happy to work with the committee and the sponsor to do that.
Yeah, Counselor, while you were at another meeting, the prime sponsor opened up by saying this is really a draft job. This was done on the fast. And I trust that now he, who is at another committee, will review the I almost said tape. I don't know what it's called now, but the recording of this hearing to pick up the various comments. Some of these issues, I think he's quite aware of.
And I suspect
there's some good stuff in here, and I think he's very amenable to rewriting with the input of people who've been testifying today.
Terrific, and I appreciate that. And again, apologize for being late in coming into the hearing. And I know back in the day the work sessions were created. I don't know if the chair has any interest in doing a work session on this bill, given sort of the number of people that may have an interest.
My hope is that they'll key into him
Fair
at
enough.
this point, and he will produce a draft amendment, and perhaps some of us might take a look at it. I do work sessions differently than some chairs.
Great. With that, I conclude my testimony. If there are any other questions, I'd be happy to answer.
Any questions of Counselor Head, Representative Raymond?
Thank you, Chairman, and thank you, Attorney Head. I have a question, and it's kind of a general legal lease kind of question. So in section 2 here, it says, well, section 1 under Roman numeral 2, it says an attorney to represent the interest of a child. And today in testimony, many people have talked about the best interest of a child. And so now it's gotten me thinking about what's the difference, legally speaking, between the interest of the child and the best interest of a child. Like what's the demarcation there?
So thank you for the question. I think the demarcation I might make differently. Best interest of the child is the legal standard for the judge to apply when making a decision relative to the child, and that's laid out statute. And I don't want to sort of bore you going through the statute partly because I don't have it in front of me. I think the testimony was the difference between what are the best interests of the child, which is done through testimony and the investigation and the process, and what the child wants. And what the child wants can be dramatically different than the best interests of the child. Children obviously are not always interested in their long-term best interest, but something that's happening tomorrow or now. So, those two are very different concepts. The interests of the child and the best interest of the child. I don't think there's a legal difference per se. I think best interest of the child is the standard that we're applying when evaluating the facts, expertise, and reports as courts when making decisions. May not answer your question. I apologize if it didn't.
In line 1 of 2A, in cases involving a neglected or abused child under this chapter, where the child's expressed interests conflict with any recommendation of the GAL, we've been circling around that just now, that the child's expressed interest could be, I want to have a pizza at midnight, and the GAL says no way.
I thought the earlier comment from DCYF was appropriate in terms of any does mean any, and it can become quite trivial. So I think that's a fair point. We're just not taking a position in terms one way or the other, have input in terms of what the right language should be.
And yet changing the word there to the child's best interests kind of, to me, may moderately disenfranchise the child from having a different opinion from a GAL. Because if the GAL thinks this is the best interest of the child, then it really doesn't matter what the expressed interest of the child is. And to me, that's just a little bit too much pushing away.
So I don't think, and I think I better understand the question that was asked before. I would say one represents the interests of the child is a want of the child as a practical matter in terms of that sentence. In terms of the best interest of the child, it's not only the guardian ad litem report that obviously is a significant contributor to the information that is received by the court, but there may be other information and experts or factual testimony that's presented that are taken collectively together for the court to make an ultimate decision on what are the best interests of the child. The guardian ad litem is a significant, but only one aspect in terms of that decision making.
But that would then render the child's interests irrelevant, the child's expressed interests. So as not a participant in that group. I'm looking for a word between expressed and best, where the child does have a say, and it may not necessarily be what the GAL wants, and that's tough on the GAL in a few cases, maybe.
So I think if you look at the rule that was referenced earlier in terms of one of the obligations of the guardian ad litem and CASA is that if the guardian, and this is what the rule says, If a guardian ad litem is aware that a recipient of the services disagrees with a recommendation being made by the guardian ad litem, the guardian ad litem shall fully advise the appointing court of this fact. I think that is good language in
Yeah, that
terms
is
of,
good language.
of what I think you're trying to address. That's just for reference purpose. It's GAL rules GAL 504.01.
Thank you. That's very helpful.
Great.
Anyone else? We have one final pink card, and after that, I will be closing the hearing, and the chair recognizes Betty Gay, the Honorable Betty Gay,
I'll try to wear that proudly.
also an alumnus of this organization, as I recall.
Yes.
Alumna, excuse me.
I'm an alumnus.
An alumna, A.
Oh, okay.
Plural AE, masculine US. You may continue.
Okay, I'm just going to give you some observations from working with children who have had bad experiences in family court. I share the same concern that Attorney Head just expressed about attorneys being appointed for children. Who's paying them? Because that can have a lot to do with what the attorney recommends. It also is the same problem that we have now with court-appointed GALs. So I'm not surprised to see that some children have expressed a different opinion from the GAL that they were assigned and have heard some pretty bad horror stories. So it's the same situation. Who's paying the GAL often has the most sway in the decisions of the GAL, the recommendations of the GAL. I really don't like to hear it said that we can't afford to be fair. I've heard this excuse before on recommended changes in the court system. Well, we can't afford it. Well, we're guaranteed rights. They didn't put it in the Constitution, either one, that we don't get the rights if the government doesn't feel like paying for them. So that's our job, is to fight for the money to make this happen. I'm trying to make sure that I don't repeat some things. I'm curious, too, that on lines 15, when it says the minor child who is the subject of such proceedings, is they referring right then to this subject of neglected and abused children? Because if it is, that needs to be specified. Because otherwise, it does sound like all minor children shall be entitled to representation by counsel. Well, right now, almost all children who get involved in family court, like in a divorce proceedings, there's no choice. They get assigned a GAL. Only the court doesn't have to pay for it. So they can be very generous in ordering it. And then the parents get stuck paying. And often the services can just go on and on and on and on. So that's another subject ripe for reform. So many bad experiences have been reported to me when the GAL does not represent the child. So I don't have any solutions here. I just see some places that we could tighten up the wording to be clearer. But it's my experience, my conclusion is, my experience is that children often want to be heard, have been absolutely refused to be heard. Maybe not in this kind of case. Maybe neglect and abuse, they always get heard. But it doesn't sound like it. And definitely in divorce proceedings that can get carried on forever, I've definitely met kids who were very bright, who would write letters. They sent letters to the judge, but they were never permitted to speak, and they really wanted to.
Any questions for Representative Emerita Gay? Seeing none, thank you so much. And I would strongly suggest that folks, both who testified and of the committee, share your thoughts with Representative Hole. It may be that this becomes an early bill when the fiscal note shows up, so we don't have very long to do it. This concludes the hearing on House Bill 535. And before you go anywhere, we have another bill to hear, and let me give you the background story to it. As you know, the Sununu Youth Center is scheduled to close very soon by law, and we have no replacement for it, even in the design phase. So the Senate and the House have been working very much behind the scenes as quickly as we can to come up with a bill, and we have been given House Bill 120. If you have House Bill 120, ignore it. What I am about to pass out to you is House Bill 120 Amendment 0084. This language is identical to what the Senate just passed like a day or two ago. And so this is the current Senate version. What we will be asked to do down the road fairly soon is to go along with it. Thank you. And that would happen to be Senate Bill. Did this just come out? Did he indicate when this was voted on by the Senate? I would appreciate that, because they're supposed to be today, the Senate is, taking a look at it in finance. So 120 FN, the amended thing that I'm about to give you, may be a good document to have. And maybe what was just handed to me is an amendment to this. Does it sound complicated to anybody? Yeah, and confusing too. What we're trying to do is come to an agreement between the House and the Senate through the committees, through the financial committees, through the floor in voting, and out the door and signed within the next few weeks. I mean, this is head spinning. But that's the only way we can have something legal to extend the life of the Sununu Center and go forward to what the department really needs. So I'm going to hand out these documents to you, House Bill 120, and then I'm going to hand out Senate Bill Senate Bill 1 amendment. You're going to have 2 different documents. No, you're not. You're going to have 3 different documents. Ms. Dyer, you've given me 2 different amendments from the Senate. Okay. And you were right there on the spot. So you're going to get 3 documents. And I just ask you to read them, make little smiley faces all over them, doodle. We usually do. And is it somebody with his hand up? Well, I don't see anybody with his hand up because I'm looking down. But now, once you have all 3 documents in front of you, the kindly gentleman with his hand up will please approach.
Mr. Chairman, Senate Finance did pass out SB 1, and they passed it with 2 amendments that you have. So it was passed unanimously out of Senate Finance at 1:30 today. That's what you have in front of you.
And who are you, sir?
Chief Hemingway Point.
So take the next 25 minutes or so and read through these things, if you would.
If this is a new bill we're looking at, then I don't think we can, are we not going to have a public hearing on 120?
We are having a public hearing on the documents before us. This is a very unusual thing.
Yes, I don't know how that can be if we advertise that we have a public hearing on 120, how we can jump into another bill.
We're going to do it.
Without doing without posting another hearing. Amendments we can do, but I don't know if we can go to another bill, particularly one from another chamber, the Senate, without advertising we're going to hear another bill.
Well, I take what you've said under advisement, and my ruling is we will do this. And the only way we won't is by a challenge to the chair, and I would not recommend it.
Do what of the chair?
Challenge of the ruling of the chair.
That means override the chair.
Mm-hmm. We're going to discuss it. This is going to be a discussion. 120, as you know it, is dead. It is now followed by some other documents. We're going to discuss those.
Just I mean, these amendments haven't been noticed, so I'm wondering if it's proper to change the bill.
It is.
It is proper, even though these amendments haven't been noticed.
These are unapproved, so these can be considered, but
Yes.
cannot legally change the bill.
Right.
You can't.
Right, we gotta hear the original 120.
Open the hearing on House Bill 120 on the Sununu Youth Services Center. And as we all know, this is a work that's going at warp speed to try to accomplish some good work in a very short period of time. And both the House and the Senate are working on this, and we hope to have something on the governor's desk in 4 to 6 weeks. Chair recognizes the chairman of Division 3 of Finance, the Representative Jesse Edwards, who is going to present his bill and comment on the amendment to it to make sure that we're getting the latest updates. Representative Edwards.
Thank you, Mr. Chair. For the record, I'm Representative Jess Edwards, representing Rockingham District 31. I live in Auburn, but represent 3 other towns as well. I have been tracking on the Sununu issue for quite a while. I was appointed to a special committee that was chaired by Senator Gary Daniels to take a look at options for closing and replacing the Sununu Center. We did a lot of work on that, published a final report. Plus this hit Division 3 after it passed the House last year, and so we had a pretty good bill that we took into committee of conference, and there was I'd call it miscommunication, and the fatal flaw in the miscommunication is that the bill to replace the Sununu Center died in committee of conference, and that was a really bad thing because as it left our current law to say that the Sununu Center must close on the 1st of March. And so those of you with the calendar clicking in your head, that's like 5 weeks from now. We have looked at alternatives on what to do with these kids. One of them, just to give you a worst case scenario, one of them is being detained because of allegation of murdering parents. So these can be pretty serious cases in there. And it isn't really clear to me what happens on 1 March if we don't pass something. I don't think the commissioner has good alternatives, and it may include having to send some kids out of state. Could cost a lot of money to do that. Could be bad for their therapy. So what I'm really imploring this committee to do is to understand that we're on a very short window here, and that the people who disagreed in the committee of conference last year are either completely in sync with one another now or are no longer serving. So so based on some of that, I wrote HB 120. Simultaneously, there was an SB 1 done by Senator Carson. She had me work on an amendment for her, which is how closely, I share that just to let you know how closely we've been working with one another. She asked me to write an amendment that took some of the best part of hers and the best part of mine and build one. And so although I'm introducing HB 120 today, I would draw your attention to amendment to HB 120, 2023-084 hotel, and that I think that has all been distributed before today. And so this was an amendment that is replace all of HB 120 with this document. So HB 120, as we used to say in the military, is OBE. It's been overcome by events. The version that we're going after now in the House is this amendment, which mirrors what the Senate passed 22-2. And one of the vital things we're doing and have to do as we fast track this is we have to keep the both houses in sync with one another, because if we get out of sync and all the way down to a comma, they have to be identical to help us facilitate rapid approval by both houses and getting it to the governor. That's really where we achieve our success criteria, is to get the governor to sign this before the end of February, so that the 1 March closure date is obviated. So with that, I will begin to talk about some of the more interesting aspects of the amendment. And although much of this is consistent with HB 120, I just think for the committee's purpose, it would be worth highlighting these. And I should have mentioned that the committee chair had invited Division 3 to join us. And could you raise your hand if you're Division 3 so I could? One. Okay, and thank you for coming. I wanted Division 3 to be paying attention to the questions and the introduction of this, so that we're better prepared as the Finance Committee to receive this product if it clears the House, that we can handle it more quickly. So the main issue in committee of conference was the capacity. Some people wanted 6, others wanted to plan the facility to be able to operationally intend to support 12, with a maximum ability to handle 18 for sort of exigent reasons. I was talking to the director just a little while ago, and although I had known that our census has ranged in a very kind of consistent manner around 12 to 14, he mentioned to me that we hit 18 for the first time in a couple of years. So to me, I think it's validated that the 12 with a potential to go up to 18 is a good census data-driven target. Now, in order to maximize the use of that space, we're asking that the interior space be designed so that there's some flexibility. So, like, for example, if you've got a combination of men and women in there, it's easier to divide the sleeping areas and the common areas as appropriate. If you have members of competing gangs, for example, it would be easier to segregate them to increase safety. So the design is going to have to create or be capable of being somewhat flexible. Now, the location of where this thing goes is a topic of a lot of rumor and concern. 3 places have been named. I'll let the director talk about that, but I just want to tell you that from the legislation's perspective, we presume that a location has not yet been picked. There are some good ideas on where it may go, but officially and technically, no place has been picked yet. But because there are community concerns, if you drop down to line 23, you'll note that this amendment says that we will implement any reasonable request by the communities to ensure safe operation of the facility. That is future work. That is work to be done after, we get deeper into the site selection mode. It's premature to have done that at this point. Another key point, and I know this is really important to the advocates, is covered at line 25 and 26. At the end of line 25, it says, "The facility shall not be administered by any non-governmental entity." What does that mean? There has been discussion, because it's important to discuss all alternatives. There has been discussion about, well, should we consider contracting the entire operation out to a for-profit entity that runs these kinds of things? And categorically, every conclusion has been no. We do not want to do that. We will not do that. And so what 25 is meant to say is, given that it shall not be administered by any non-governmental entity, it goes on to say it shall be administered by the Department of Health and Human Services. Now, keep in mind that the locations being considered are on state property. It's going to be built with state money. It's going to be in law administered by the Department of Health and Human Services. And so for those who may be concerned about ownership or control, I believe it's pretty clear that the legislative intent is that this is the state is accountable and is responsible for making sure that all operations are done properly. Now, we'll see later, but it's good to mention now that one of the drivers for wanting to close the current Sununu Center is because there has been frustration over building for maybe 10 years, that the Sununu Center is pretty expensive on an annual basis. We spend about $13 million a year. You can do the quick math if you've got census of 12 to 14, what that works out to be. Now, it's not the same 12 to 14 year round. There's movement in and out of the facility, but the daily average census tends to stay between 12 and 14. $13 million a year, that's quite a lot. So we think we can do a more efficient job in a facility built and designed to create a therapeutic environment. When we first built the 144 person facility that we're currently in, 144, what we built that for was more of a juvenile incarceration center. The model was very much about jail and imprisonment. And what this legislation does is it says it's going to be the policy of the state to worry about the therapeutic treatment of these kids and basically the restoration of them back to civil behavior. If you go to the next page, page 2, very first line, it's mentioned that once we open the new facility, it'll be called the YDC and not the Sununu Youth Development Center. I've gotten feedback by interested parties that they don't like YDC, and rather than introduce a little bit of chaos between keeping the Senate and the House in sync, what I've asked is for these things that are really not relevant to pushing out the deadline and getting them started on architectural design, let's keep that separate so that we can pass a bill in January of 2024, or at least begin to. The naming of the facility is not on the critical path, I don't think, and I hope you would agree with that. As soon as the new center is open, on line 7, it basically says we're going to close the old system for detention or admissions. Starting on line 10, it talks about some facility design issues, Alpha through India, down from lines 10 to 26. I think the first bullet is critical, that what we're trying to do is complement a therapeutic and trauma-informed care of the children there, to try to make it a home-like interior and exterior to the maximum extent practical. Now, that this also has to be done to make sure that physical security is clearly in place, and that these kids are detained in a controlled environment where they cannot leave the premises without proper authorization and escort and the like. So, so one of the major transition points that you don't really see in this bill is that SB 14 back in 2019, which has since become law, established an acronym CAT, and I think that's a comprehensive assessment therapy plan, treatment plan. And so the CAT is something that is an assessment of somebody who contacts the behavioral health system and needs some treatment plans. And so some portion of the kids that end up at the new YDC are going to have these initial assessments. And so we'll be able to hit the ground running, in theory, that with a continuity of care for what these youth need. That's different than if you had walked in a year ago to see what happened. All the initial assessment and stuff took place on day one, and it wasn't until later that it was clear what kind of a treatment plan was appropriate, and there was not a connection to the community. And so I think one of the things that we have going in our favor in this redesign is that it's anticipated the integration with the system of care tied together by this CAT, and so that when they get to the new YDC, we're going to be working on a therapeutic and trauma-informed care basis. So that's good. And later, if you jump down to line 28, it says operations may utilize virtual and shared services. So what the hope is there, and what the communications have been, is that telemedicine can be used to link the youth that are at the YDC back with their community providers, so that there's more continuity, and that should result in a better outcome. The telemedicine is not the only thing that can be delivered with a remote or a virtual service, as we've learned the last couple of years. Educational augmentation may be a possibility. Nice interaction with their family who may not be able to travel to the center, but can still engage with them using good high-end equipment. So emphasizing the virtual, and now on the shared side, if we can co-locate this facility with another facility that is operating under essentially the same model, that opens up the possibility of sharing services. Like, one of the most scarce things we have in this state are trained manpower. And so by having a co-location with a similar facility, it's hoped that any manpower shortages might be able to be compensated for by having better sharing arrangements. But the care model isn't the only part that can be shared. You can share very fundamental things like laundry services, warehouse and logistics services. You can share some security services. So by emphasizing that the plan should include virtual and shared services, what we're trying to do, particularly with the capacity reduction of an operational size of 12, is we're trying to dramatically shift that cost basis from $13 million a year to a much lower number. And I'm not prepared to give you an estimate, but I've got to imagine it'll be on the order of a third of what it is now. The director may have a better wag than me, but a lot of this analysis hasn't been done, but it's just got to be less expensive. So for the community that receives this, I think line H is important. Line H on line 24, where it says necessary elements to be architecturally secure and equipped with video surveillance in compliance with that RSA statute. What that RSA statute is something that the legislature passed last year and was signed into law, which says that there shall, essentially it says there shall be no blind spots. So wherever there's a common area, it's capable of having the acuity to pick up individuals, to know who's who, and to be able to monitor behavior in common areas. Now, of course, privacy concerns are also built into this. You don't want to have, bathrooms in the wrong place, or cameras in the wrong place in the bathroom or in their bedrooms, for example. But I'm going to leave that to the engineers who are going to look at that law and apply some real world expertise to giving us something we need. That law also says that we are going to archive these videos for years until the data retention period expires, and that the equipment must maintain a 98% uptime or better. that was done at the request of the AG himself, who has taken a look at our video evidence and cases in the last few years and realizes that our uptime isn't what it really needs to be. So we start into line 27 and 28 where it talks about staff qualifications. I think everyone in the community feels good that we're looking to primarily bring in therapeutic staff in here. We're going to make sure that they are trained to also protect themselves and others in a group. We're going to make sure that they're trained in de-escalation techniques so that we can keep a safe environment internally for every individual and every employee, and then also reduce the need for external law enforcement to get involved and reduce the anxiety, the community that these people may leave the premises and become a threat to public safety. So that's going to be looked at. There has been some discussion that this version of this amendment doesn't go far enough, that we ought to get a commission together composed of some reps, some senators, some local people to really build out a plan that dives into the procedures and practices that would be followed. So you don't see it in this version, but I could anticipate that that by the time this gets ready for the House floor the last time, it will have provisions for a commission to look at the security issues. You'll notice on page 3, on line 3 and 4, it talks about the wraparound support upon admission to plan for discharge. So the whole system is being, again, to make the point, this is being built on a therapeutic model where the juveniles coming in should more than likely have some sort of contact with a behavioral health specialist and have this CAT form come in to keeping them engaged with their providers during their stay to when they get discharged, have a graceful transition of the discharge. So we're imagining an entire wraparound support system with the hope that this is going to improve the behavioral health aspects of each individual and certainly address some concerns about recidivism. And I practiced that word all last night. I think I got it right. Recidivism. Okay, so further on page 3, we have a paragraph here that is pretty good about telling the department what they need to do to give us quarterly reports. In this version, it says that those quarterly reports would go to the Joint Legislative Oversight Committee and also to the Office of the Child Advocate. And then there was an aha moment where it should obviously also go to the Fiscal Committee. So I can imagine that by the time this gets ready to go to the House floor for the final time, we're gonna see the Fiscal Committee mentioned as well. We're also going to make sure that any money that we give them for this purpose can't be transferred into any other purpose. That's not clear in this, paragraph 6, but will be. I think of interest may be on page 4, line 13 on down. Essentially what we're trying to do between 13 and 22 is to talk about potential disposal. Now, when we vacate the Sununu Center, it's going to turn over to be under the control of the Department of Administrative Services. The Administrative Services Department is going to start looking for the best alternative uses. They may get a head start on it, but officially that clock doesn't start until they become accountable. And what this legislation does is it encourages a prioritization of having that key property. If you've never been to the Sununu Center, it's on some of the most important, valuable property, I think, in the state due to its proximity to commercial life and routes of access. And so we're encouraging that they look at the next use to improve the tax and business rules of the city and the state. There's an appropriation of $15 million to begin all of this analysis. We direct that the governor shall look at some discretionary funds like in the American Rescue Plan Act to see if they can be allocated to put a dent in that $15 million to reduce the burden on the general funds. So that's kind of a walk through the amendment to HB 120 0084 Hotel with a couple of rubs that probably need to be fixed in an amendment to the amendment. But I'm not here to advocate for those yet because I don't have a House amendment to share with you at this point, just concerns that are on the radar. So, in summary, I really need you. We need you. The kids need you. The community needs you. We got to get this passed so that we don't end up with a forced closure on 1 March. So, and it's important that anything that we disagree with on this, we look to really align closely with the Senate so that we can get this bill passed expeditiously. And I swear I'll keep a list of things that you think are issues so that we can introduce it in a new bill January of 24 if needed. So with that, I'm willing to take questions, Mr. Chair.
Thank you, Representative. You have done a lot of work on this, and you have done Henry Kissinger level shuttle diplomacy with the Senate. How's that, huh?
I'll take it.
And
I don't have his accent.
that's another point in your favor. We will keep a slot open on Tuesday afternoons in this committee so that if you have something to bring to us, especially in light of what the Senate is passing, we'll be able to be ready right away to exec what comes to us.
Yes, sir. I appreciate that. And just to give you foreshadow a little bit, I think the amendment that I have is going to be amended one more time. It's going to be very much like this with the points that I just verbally mentioned, so that there's still just one amendment overall, but it'll really be the one that I advocate for us to pass.
Will that, as much as possible, mimic what the Senate is doing and the amendments that they've been working on?
Down to the comma.
So there will be no need for a committee of conference?
Okay, I've never fast-tracked a bill.
Neither have I. I'm just making it up too.
I don't know how that works. I sort of feel like I'm running a relay race, and I'm just running as fast as I can, grabbing the baton and getting ready to hand it to the next one. I have no idea how this race ends.
That's why we get the big bucks.
Yeah.
Any questions for Representative Edwards? Representative DeSimone.
Thank you, Mr. Chair, and thank you for taking my question. In reading the amendment in the bill, I didn't see anywhere that the state would implement a system that any surrounding communities, wherever the facility is placed, their support, police, fire, whatever, would be reimbursed at all. Is that in the bill? Am I missing it?
It's in the amendment that you've not seen yet. It's absolutely agreed that the amendment I just introduced to you is missing a key component.
This just in.
Okay, so thank you, and I'll integrate your correction and your teaching point. But there will be a commission that will work with like the municipal governing board, local law enforcement, the sheriff's association, the child advocate, the commissioner, Department of Safety, and it's my belief, and Mr. Ribson points out that on lines 22 to I think 25 or so, it says that the department shall, to the extent practical, implement any reasonable requests by the communities. I did highlight that in my introduction, to ensure safe operations, implement a payment. Okay, there you go. That's the money line you're looking for. Line 24. Implement a payment in lieu of taxes arrangement to prevent the shifting of costs to local taxpayers and to ensure the cooperation of the prospective community. So that's our strategic direction. The commission is going to be the required vehicle to get us there.
Representative, I might suggest in terms of that you look at the changing of the word community to communities. Just for the sake of argument, let's suppose this is cited in Hampstead. We already know with the use of Hampstead Hospital, there's memoranda of understanding between the state and the town and so on. And one would assume the same would happen no matter where this facility is cited. But should this be cited in Hampstead, there would need to be an arrangement, to your point, Representative, for mutual aid from police and fire for towns abutting Hampstead. So I might suggest that be changed from community to communities.
So you know what they say, great minds think alike. I didn't consider that at all, but Senator Abbas did. And so somewhere he's mentioned that we should be talking about, and in one of these versions, we had the phrase adjacent or contiguous communities.
Whichever you can spell is fine with me.
And I, you know, with Mr. Lamb helping, I can probably spell them all. But I have to go back through here. I'm juggling like 4 different documents, and I don't know where it is. That's a good point.
Representative McMahon.
Rep. Edwards, thank you for your work on this, by the way, as well. Relative to your comments earlier of the previous conference committee that begat no decision, do the amendments and the ones coming meet the challenges that were expressed during that conference committee?
Okay, I'm gonna do what may sound like some marketing here. The committee of conference got into the crunch time, and there were some opportunities to improve it, but because the clock was running, a lot of the improvements didn't really make it in. The committee of conference failed around the capacity issue primarily. That was the big elephant that crushed the boat. But what we have done is Senator Carson, she came up with some improvements to the committee of conference. I had come up with some improvements to the committee of conference. These things got integrated, and the Senate passed their amendment 22-2 to take the committee of conference as the baseline and make it better. So I would use the term new and improved.
Just one follow on the 22-2 vote. Is that what just happened this past month?
I think it was just last week. I'm losing track of time, but this Edwards amendment 0084 is exactly what passed 22-2.
Got it. All right. Thank you.
Yes, sir.
However, it is fair to say that the Senate has made 2 amendments today from Finance, and that will work its way into what you may present to us next week.
Right. I have one more amendment to the amendment.
Wonderful.
Yep.
Representative Long.
Thank you, Mr. Chairman. Thank you, Representative, for your due diligence. I know the headache that this has created, and you did a great job. My only concern is you had mentioned first page, line 25 and 26. Administered.
Wait a second. I have to see it. Okay. First page, 25 and 26.
Right.
Yes, sir. I'm ready.
I'm unfamiliar with administered. I'd like to see operated, owned and operated, and administered by DHHS. You know.
Can I tell you that would be a great thing to put into like a January 24 bill. And the reason I think I'm okay with this is that our legislative intent is that this is going to be on state property, built with state money, administered by the department, with the department encouraged to look for sharing and virtual services. I don't think there's any doubt that the intent is to go ahead and have the control exercised by the department. And I think that's what your concern is. Does the word administrated versus operated, or the use of them both, connote that control better? I'm not an English major. So in the discussions, we agreed that administered was sort of a more enveloping term than operated, that operated feels more like a day-to-day operations, a more, more employees, fewer shared services, fewer shared contracts. So we chose administered intentionally. Now, I'm reluctant to take on changes that the Senate isn't in sync with, for fear that if it's not comma for period for word, we have a problem with getting this passed fast. And so what I'd like to ask you, Mr. Vice Chair, is the addition of the word "and operated," that term, is that significant enough to you to where it has to be there before you can support this bill? Can it wait until sort of a cleanup bill, January of 24?
You may answer.
Thank you. I mean, as far as supporting this, I get it that this is an emergency and it needs to be done. However, I would prefer to know that it'll be operated by DHHS.
Could you help me understand the word operated? Does that mean
No,
100% state?
I'm an iron worker.
Oh, okay.
I cannot.
All right. I was hoping to build
stand-
something with you that would stand the test of time, but
But my iron worker mind says operated means operated. And administered, I don't know where that gray is.
yeah.
And
Do you-
administer. So I would prefer, will I vote for this? I still have some more
You got time.
testimony I need
Yeah,
to hear.
yeah, right.
However, I would be comfortable with operated. That tells me that it's going to be operated by DHHS.
Does the word operated, do you mean that there can't be contracting of subordinate parts of the operation to private entities?
Oh, there can be.
They can be.
Yeah. That,
Okay,
absolutely.
so
Yeah, like
so
a
conceptually we
barber.
agree. It's just getting the words right.
Right. Like the facility shall not be administered by a non-governmental entity.
Yeah, that's what.
So, I mean, does that mean that a barber, I can't hire a barber to come in and cut people's hair?
Yeah. So I'll tell you what, I'll because we have such a long history and I trust your judgment, I will try to find a spot to work that in with the Senate. And then the chairman has said he prefers communities, plural,
He
instead
does.
of community.
Well, that's for my friends in Atkinson.
Yeah.
Thank
yeah.
you, kind sir.
You're welcome.
Okay. Just
So,
keep in mind.
Thank you, Representative.
All right.
I'd appreciate that.
Yeah, I will endeavor.
Any-
And check me when I come back with the amendment to the amendment.
Any further questions for the representative, however abstruse they may be? That's not to say yours was.
The way I took it, my iron worker mind says you attacked me.
You were selected here for a reason, sir.
Mr. Chairman, over here,
Representative Bigford.
may I? Thank you, Representative Edwards. I have a series of things I'm wondering about because I haven't been here for a little while. I was here when we created the Sununu Center. I went to the inauguration of it.
We were looking for someone to blame.
Well, I'm glad you said that because I don't know what's wrong with it. It was state-of-the-art building. We even named a portion of it after Lionel Johnson, who used to sit on this committee.
Totally a joke. Sorry.
Oh, darn. Okay. So I'm at a loss. What's so bad about it, except $13 million to run it. I thought it was a beautiful building.
It's more than that. Have you asked the
Well,
asked the question?
yeah, so at some point, I'd like to know what the differential in cost is going to be. I didn't see that here. You said $13 million, so therefore we need to do something. And that's the only thing I've heard so far that says we got to get into a different building because this one costs too much to operate, which I expect most of the operational costs were for people
Right.
that run the place, because the facility, we got most of the money from the federal government. That's why it's called the Sununu.
Right.
Because Sununu was able to procure the funds for us for that building. And I wonder if that building could be used for mental health or homeless problems that we have. I guess we don't need as much. We used to use the King Cottages prior to the Sununu Center, and the court ruled that we had to do something different, and that's why we went into the
Right.
Sununu Center. And a lot of people thought that that wasn't going to be big enough, but apparently it's too big now. So, and if there's this emergency, so far all I can understand is because we have a date to sell it, and that if it's just a date to get rid of it, that's an easy bill to push that through without worrying about getting the new one built. We can come back and do that. So if any of that you can help me with to understand.
I'd say it's the opposite. The problem isn't disposing of the building. This bill doesn't say how it will be used in the future. Just simply says we'll turn it over to DAS and they'll figure it out once we're done with it. But we're not done with it until we can move the kids into an appropriate setting. And so just to put it in financial terms, you got to look at it from an efficiency and an effectiveness perspective. We're looking to gain efficiency by consolidating the amount of space that needs to be controlled and supervised and cleaned and heated and all of that, and get an appropriate size staff, a staff built for 12 instead of a much larger number. So we're trying to gain efficiency, but that takes our eye off the other ball, and the other ball is the effectiveness. What we've determined is that sort of the hard wall, concrete, cinder block prison feel of the Sununu Center is not appropriate to the kind of therapy-centric care that we want to provide to these kids. So the environmental setting will become much more home-like, and I think I pointed out that particular paragraph where we talked about that. It's on page 2, line 12, and it just kind of goes, a physical design including a home-like interior and exterior to the maximum extent practical. What we're building is more like a treatment center and less like a prison. And that's what Sununu is now. It's a facility appropriate to a prison. It's a prison that can hold up to 144. I don't know how we ever thought we would keep 144 kids in there. I wasn't here then, but as I've seen the census provided by the department, it wasn't all that long ago, 8 years maybe, where we were having a census like 80 or something, and that has trailed off in the last 2-3 years to where the range of 12 to 14 seems to be the steady state. So we're building a facility more suitable. We're building a facility where we can co-locate it with a similar facility to leverage capabilities, gain some efficiency and some expertise in child development and behavioral health. So what I meant to communicate when I talked about the $13 million a year bill cost is that over the years, more senior members of the finance committee than I am, this is only my second term on finance, grew very frustrated that they weren't getting from the department what they thought they needed in terms of a cost reduction plan. And so there was this pent up urgency to basically force the issue. To be fair, if you went over to the department and you ask them, they go, "Oh, legislature never told us to do that. Where's the bill? Where's the HB that made us go do that?" And so I don't know. I wasn't here. It sounds in retrospect like entities talking past each other, and now the department, the two houses of the legislature. I haven't mentioned the governor's office. They're all, I think, in sync on what the replacement ought to look like. And we can't close what we have until we can replace what we have. And so this bill is about the replacement. So it's a long answer. Is it on point?
Do you wish a follow-up, Representative Bickford?
No, not at this time. Thank you.
Okay. Anyone else? Representative Levesque?
I don't know if, thank you, Mr. Chair, and thank you for taking my question. I don't know if you can answer this or someone else that's going to speak. When discussing the de-escalation techniques, what exactly would those entail? Because as we know, like dealing with children, it's hard to cross that line between making sure that they are safe for themselves and when it's like abuse almost, and what those de-escalation techniques look like and what they are. I don't know if you could answer that or someone else can.
So, okay, so I'll give you the big picture, and then the department can provide detail. But there's sort of in engineering, there's this top-down structured approach to building things, and we're kind of at a higher level. We know that we have to get to the depth in order to answer your question. And so what we've done at this higher level, which is in this bill, is just to include de-escalation as a technique. And we kind of feel ourselves to be a bit enlightened, because the whole concept of de-escalation in law enforcement, I think, is just more or less of a relatively current topic. Now what the details of that are, there's going to be an opportunity long before the new facility is reopened to work that out. So I think we also said in here that to the extent that they can begin this new operational model of therapeutic help, that they can begin implementing it. So the answer to your question is still TBD, but it's obviously going to be on our critical path to opening.
Representative Grossman.
Thank you, Mr. Chairman. Thank you, Representative, for coming before us. And my question is related also to those therapeutic. Have the therapeutic changes happened? I know we're talking about the structure of the bill, but at the current Sununu Center, the movement from incarceration towards community-based therapeutic changes, have those begun happening already at the Sununu Center? Or are these changes, these movements happening once we get a new facility?
Excellent question. Excellent question. Mr. Ribson will have the details of the exact status of the implementation, but I do understand, I think, the context of where we're at. The legislature was obligated to get this bill to the governor for passage back in June. We didn't do that. So if you're an employee at the Sununu Center, what we just did was we unleashed a tremendous amount of uncertainty. And one of the things you may have tracked is that they've had both attrition problems and recruiting problems, and to the point to where they've had some violence erupt inside because they're just not adequately staffed. And so there's a saying that says something like it's hard to remember you went in to drain the swamp when you're wrestling with alligators. And so I think that the declining staff has made it more challenging for them to begin implementing the therapeutic model changes. But to the extent that they have, I'd give them kudos, because it's tough to do it in the face of massive attrition.
Further questions for the representative? Seeing none, thank you, and we'll see you again next week.
All right. Thank you so much for the time.
The chair recognizes Cassandra Sanchez, Office of the Child Advocate. She wants to speak for between 2 and 5 minutes in support of the bill. Come on down.
Good afternoon, Mr. Chair, and thank you for your time. I am here in support of the bill, and I may be able to answer some prior questions that were asked as well about the treatment model. The Office of the Child Advocate has been very vocal in pushing for a treatment approach at the facility and moving to a therapeutic home-like facility away from, as Representative Edwards mentioned, away from the brick walls, the heavy metal doors, to a facility that will feel more like a treatment center. And so in this bill, we have been very supportive of all of the aspects that include those treatment modalities to be used, and especially the implementation of them now at the current facility. I do spend quite some time at the current facility, have met with the children, talked to them about the current therapeutic treatment, as well as the psychologist that oversees the clinical therapeutic components that already exist within the program. And currently at this time, the children are receiving one-on-one therapy. They have opportunities for family therapy as well as group therapy. The group therapy was not consistently happening prior to this current time frame because of the staffing issues that were mentioned by Representative Edwards prior. So there was, with the crisis in the facility and the unknown, there was departure of clinical staff and there was need for hiring of clinical staff. They now have more adequate clinical staff and are able to meet those needs by offering more of that therapeutic component. I don't believe they are where we would like to see them when this fully rolls out and they're able to further implement that therapeutic approach, but they are on the way already with the staff who are currently in the facility. What I do see in speaking to the de-escalation question that was asked, in my understanding of the science behind de-escalation in therapeutic settings for children, it is about using approaches where you are talking to them in the moment. It is having the treatment plans in place that identify coping skills for the child. So if they are in crisis, it's offering them their coping skills first, getting down on their level, meeting them where they're at, and understanding what may be triggering to them in that moment so that that approach isn't utilized. So if it is somebody coming too close in contact with them, it may be taking a step back and showing them that you're giving them the space that they need. And so that's what we see for de-escalation techniques in other therapeutic settings, and we would like to see that carry through at the facility. Some of that has been incorporated into the treatment plans already, but there is a training component that would come with this bill that would allow further training for the direct care staff, because right now the clinical staff are on site, but they're not on the floor with the kids at all times. And so the training needs to happen with the staff that are directly working with the children on their units, in the lunchrooms when they're mixing, when they're socializing, and also in the education setting. So really carrying that through, and that can happen through enhanced training. They're doing some of those trauma trainings now, but with the rollout and the prime focus shifting from detention center to treatment center, that will be able to enhance. I will point out one aspect of this amendment, which I did vocalize to the Senate as well. One area of concern, otherwise I support this amendment in full. The area of concern is in speaking to the utilization of virtual and shared services. And this is not saying that I don't believe that that should be offered to the children at the facility, but I do believe that it should be considered an add-on to the services already in place, understanding the amount of work that has gone into the face-to-face clinical services that are happening now. I would not like to see the facility take a step backwards and utilize virtual therapy or virtual schooling for children with IEPs if it's not going to truly meet their needs. So really taking a look at the virtual component as an add-on to the in-person services that will be happening face-to-face with the children. I absolutely see that it could be an enhancement by having a therapist in the community who has followed the child over time to have access to them while they're in the facility and communicate with their treatment team. but they should still have that because they will not have the opportunity to meet with that person face to face. They should still have the opportunity to meet with a clinician on site face to face and have that treatment come together as one and not two separate options for therapeutic care for the children.
I read that line to mean if the facility were sited right next to another facility doing similar work, they could share food services and not have to have two completely separate ones. And that if, let's say, Hampstead Hospital has certain staff people gifted in certain areas of mental health, those people could actually work at both. Under that heading, I would see that shared services could be an advantage and not a disadvantage.
In that aspect, yes, I'm speaking more to the virtual component, not necessarily the shared services. in
Thank
that
you
way.
for that clarification.
thank you.
Representative McMahon.
Ms. Sanchez, as a specific to what the chair just referred to as well, would wording saying operations shall include utilization of virtual, shared, and in-person services?
I'm sorry, can you point me to the line that was on?
Oh, page 2, line 26.
Oh, yes. Yep.
And in the interest of inclusion, so that the three disciplines can be recognized based on need of the individual, is that, do I understand that's what you're recommending or suggesting should be included? Those three options, or should one of them be removed, like the virtual?
I believe there's another location where it touches on a virtual component, and I believe it's in the education area.
What page and line would that be? Oh, 310.
Thank you. Shall be, yes, right there, it notes virtual education opportunities shall be leveraged appropriately to help meet the residents' needs. So ensuring that this would not allow, this language would not allow it to be used instead of, but as an option if it is a good fit for that specific child, but not that if there's not access to an educator that they will be able to supplement by offering virtual only to the children on site. Does that answer your
If I
question?
may, the question was specific to including the three opportunities and what is the best therapy to utilize. Would then go to the second page there you were just talking about. I mean, should that not be included as you know? So the options, there's the three options are available, and not restricted. You know, I mean, leverage is a matter of leveraging multiple entities.
Yes. So yes, it can be utilized. It's I'm making note to ensure that it could not be intended instead of, but that it joining in both or in addition to what is already offered on site, then yes, I am in agreement with that opportunity being available to the children.
So is there any further language change versus what was offered here by Representative Edwards?
I have not offered any additional specific language to that. I did speak in the Senate with asking, as they're considering to look at amendments, to have that language say in addition to. But further than that, I have not had further conversation with Representative Edwards as to amendment language.
My guess would be that this would be unpacked by the department as it implements it. And we can trust that they know how to do it, as opposed to making sure it's written right in the bill. That wasn't a question, but it could have been. Anybody else?
Mr. Chairman,
You're on a roll. Go.
I am. Do you trust what the chair just said? Your Honor?
So respectfully, I do trust that they can do their duty, but I would like to be cautious knowing that there have been times where staffing has been an issue and have seen that the virtual option had been the only option for children. So that is why I brought that forward, because I did speak with children over the summer months where the staffing was not in place and there was virtual therapy offered to them. And many children at that time voiced that it was not enough to meet their needs and that they needed further therapeutic care in the facility.
Just one closing comment, Mr. Chairman.
You may.
My attempted humor notwithstanding, the point is well taken here, and in our past experience my past experience working with the chair and other committees, is to anticipate not what's happening, what may happen and what does happen. And you'll be working then with the Senate and with representative to have language that provides that the structure for these options will be available in black letter law.
And on page 3, line 29, it indicates the Department of Health and Human Services shall submit quarterly progress reports to the Joint Legislative Committee on Oversight of DHHS. I'll make sure.
Thank you.
You're welcome. Anyone else?
Did we take minutes on that comment just now?
That I can
Button.
make sure that this wasn't recorded.
That was the previous.
Representative
No.
Raymond.
Thank you, Mr. Chairman, and thank you, Ms. Sanchez, for taking my question. On page 3, number 5, which Roman numeral 5, which is line 26, it says the Department of Health and Human Services shall begin to implement the programming changes in subparagraphs 4A through K without regard to whether children are at the SYSC or the new facility as soon as reasonably practical. And that, I have to say, is my favorite line in this entire bill. But I'm curious as to whether or not it is practical to implement some of these programming changes in the current environment. Are there things in here that simply cannot happen until a new facility is built? Because I know that we're in the middle of a big renovation in Nashua, and I know how long these things take. So, are there things that we need to be concerned about that the kids need now that they may not be able to get yet?
I do believe that it is practicable to roll this out now for the children in the facility. A lot of it, as I had mentioned, comes down to training of the staff and the current, so changing some of the current policy that aligns with the way in which the facility operates, which can be done in the current facility. Of course, with the full facility built therapeutically, it will offer more opportunities for children to de-escalate potentially on their own, or and also we understand the impact of being in a facility that appears like a detention facility like they're in now, which can be further traumatizing for the children. So by pulling that aspect away, that will help with the treatment progress, but that will not derail the ability to start that therapeutic process now and start making some of those changes to the policies and the practices that occur in the facility.
Okay, thank you.
Representative Bickford.
Thank you, Mr. Chairman. We've heard this therapeutic word for years. In fact, when we started the Sununu Center, we heard it's going to be therapeutic, so don't worry about anything. And here we are. Now, you commented that you didn't like the idea of the bricks and mortar and bars on it. How do you envision this to be constructed?
I envision the facility to look more of what we see when we would visit a residential facility in the state, where it's a smaller building. Some of them may even be a house, and they're able to outfit the inside with the necessary video cameras, but the rooms don't necessarily have those heavy doors that lock in the same way, and moving through the building also would not necessarily have those. It would be a locked facility, unlike the residential facilities, but it wouldn't have those locks in between as they're entering or moving about the facility. And it would have a space where children can join and mix together. That would feel more like your living room at home than being in what feels like an office space right now.
Okay, so that's kind
Follow up?
Follow up, thank you.
Yes.
That's kind of where we came from the King cottages, where they had cottages, or large cottages, actually. So we're going full circle. So do you happen to know what the cost will be to run this facility, the new facility?
I do not have the operating costs. I will defer to DHHS for that.
Oh, okay, thank you.
Yes, thank you.
I see no hands up. So
Thank
may
you very
go.
much.
Donada. Chair recognizes Karen Rosenberg, Disability Rights Center of New Hampshire, and up here she writes she supports the bill, but requests consideration of an amendment.
Thank you for the
He's
reminder.
right behind you,
I know
considering
he
already.
is.
Yeah.
He's considering it.
He
He,
is.
already went forward. Good afternoon. I'm Karen Rosenberg. I'm the Policy Director at the Disability Rights Center of New Hampshire. I'm here to testify on behalf of the Disability Rights Center as well as the Juvenile Rights Policy Group, which is a coalition of several advocacy organizations who advocate for children, including Waypoint, New Hampshire Legal Assistance, the ACLU of New Hampshire, and New Futures. So first of all, yes, this has to happen. And you all and Representative Edwards and folks at the Senate have done a tremendous amount of work really rapidly to advance what will hopefully be a bill that will cross the finish line this time, that will keep kids safe, that will result in a therapeutic treatment model for children who need to be detained or committed to a secure facility for a brief period of time, both for their treatment needs as well as for community safety. And you're well on your way to doing that. So in part, my request is that you adopt what's in Representative Edwards' proposed amendment, which mirrors the Senate bill, with one tweak. The tweak is that we want to make sure that this facility is owned and operated by the department. And I think that it's really the intent of the Senate and hopefully the House that that be the case. But being an attorney, who went through that whole, law school, lives her entire life, worst case scenario, we would encourage you to make sure that it's absolutely clear. I mean, this is important because with state ownership and operation, we have transparency, right? We have unconditional oversight. We have the applicability of our state right to know law. We know with ownership that if there is a contract and the contract goes south, that we will have a facility. We're not just throwing $15 million at some other entity, who we're contracting with. So I understand that that's the intent, but like I said, in that worst case scenario game that, some of us who went to law school can't get our heads out of, it would be really clear to tighten up that language. Similarly, with operate versus administrate, the buck needs to stop with the state. The state needs to be overall responsible for the operations to maintain the safety of the children there, to make sure that this facility that we all are going to create here is actually going to do what it says it's going to do in this bill, right? We want those kids to be safe. We want to make sure that the Office of the Child Advocate has appropriate access to this facility and the children, that they're actually getting the therapeutic services that they need, and that and we can hold the state accountable to that. So this is why the language is really important. And it actually is not anything new. I mean, when you think about it, the state already owns and operates New Hampshire Hospital. This is not to preclude contracting services when appropriate, right? That's not the intention here. We're not saying like state has to, basically do every single thing, all the minutia of actually running the facility. But as we do with like New Hampshire Hospital, the state owns that facility. They contract with Dartmouth Hitchcock Medical Center for medical services and psychiatric services. So this has been done before. Similarly with Hampstead Hospital, the arrangement is that the state owns it and operates it. And I looked up recently the contract that we have, that the request that the department filed with the Executive Council for permission to contract with an entity that provides services for Hampstead. And it says, The department will be the owner and operator responsible for all functions of this hospital. This includes developing overall strategic mission of Hampstead, ensuring quality services are provided by the contractor in compliance with all contractual requirements, as well as all federal and state laws and regulations. I mean, that's the kind of thing, the assurance that we're looking for here. And it could be accomplished with a really simple tweak, which is just changing the word along the lines of what Representative Long was saying. He's the tweaker. So, and to make it clear that this facility would be owned, operated, and administered by the department, but allowing for them, I think the language that's already in the Edwards Amendment. So if you look at page 1, lines, let's see, 26 and I guess it goes from lines 25 to 27. If you replace the sentence starting with the facility shall not be administered by, and then it continues to another sentence, the facility shall be administered by the Department of Health and Human Services, you could replace those two sentences with something like that the facility shall be owned and operated by the Department of Health and Human Services with support and shared service contracts as appropriate. I think that would address this concept that, yes, it is appropriate at times to contract services. I believe that the Sununu Center currently contracts services, clinical services, and I think maybe even some educational services when appropriate. So that's my pitch.
Would you believe on my bucket list just crossed out is wanting to see a lawyer and an iron worker come to unity?
Wow.
Off
Yeah.
the list.
I'm glad I could help you out with that. Lawyers and iron workers, we're all playing the worst case scenario game. It's a curse. I'm happy to entertain any
I
questions.
don't know how anybody could top that, but if you have a question, I bet the lawyer would be happy to answer it. Or the iron worker. None? Seeing none, thank you so much.
Thank you.
Now the chair recognizes another lawyer and a New Jersey, born and raised and educated, Joseph Ribson. He's from New Jersey. Is he a lawyer?
I'll answer that question too.
He is a lawyer and, not but, a good guy.
Thank you. Good afternoon, everybody. Joe Ripsum, Director, DCOF. In fact, I'm sorry to correct you, but I'm actually no longer a lawyer. When I moved to New Hampshire and took this job, I let my license in New Jersey expire because I wasn't going to be practicing law any longer. And there wasn't reciprocity, and I didn't feel like taking the bar again.
So it's not like ordination then?
No.
Okay.
No. So it's on my license is on suspended status in New Jersey, and at some point I'm going to have to reconcile that before it absolutely is, but I'll cross that bridge some other day. So we are here in support of the bill, of the amendment. I originally was thinking I'd do a line by line, but you guys have had that opportunity already, so I don't want to exhaust everybody's time any more than necessary. A couple just big key components, right? The first section of the bill really just talks about the facility, the size of the facility, the scope of the facility. There's a little bit of data that I wanted to share, which was in the PowerPoint that I shared a couple weeks ago, but we didn't make it that far. So I'm going to hand this document out. Thank you. Melissa. This is just data being passed around showing the census of SYSC. It is the actual daily census, which is why you see it jumping around so much, from July 1, 2016 through January 1, 2023. And you do see the actual census back in 2016 and 17, sometimes peaking into that mid-70s level. And then you see kind of this, this kind of crash around like 2019 and 2020, where you start hovering into this kind of 20s, 30s, and then kind of staying within those teens from that point. That was around the time that two different things happened. One, the advent of the children's system of care, and 2 changes in law around who could be detained and committed at SYSC. So those 2 things kind of happened at the same time around then, and that's really when the census at SYSC dropped to what it is that we see today, which on average is 12, but on any given day could be as low as 5. And as of 2 days ago, for the first time in 2 years, actually did get up to 18 for 2 days. Before 2 days ago, the highest we had seen was 17 for a few days. But so the census can get, and it was as low as 5 in November, right? So the census can move pretty quickly, pretty dynamically between those numbers. But it hasn't exceeded that number of 18 since early 2020. And that's kind of what we're banking on. The really next portion of this bill goes into kind of what we're talking about in terms of what we want the facility design to look like and what we want the facility itself physically to have, right? Both in terms of the number of kids that it can serve, but also that we need visibility for staff. That's one way that you're able to kind of be a little more efficient with your staffing patterns, is ensuring visibility. One of the challenges of working within a 144-bed facility that's spread out quite far is you have poor visibility, and therefore you have to have, sometimes, depending on how your staffing and your youth are structured, more people in the building to spread out than you would if you were in a space that you have better visibility and kind of staff and youth within a closer space. Talking about having, just things for medical, physical, behavioral healthcare needs, flexibility in space. So we're talking about 18 beds. It's not that we anticipate having 18 kids there typically. As I said, we're typically looking at an average of 12, but we often have kids that need to be separated for different reasons, right? So it could be separated because you might have male youth, female youth that you don't want to have them sleeping in the same quarters. You may also have youth who can't be sleeping in the same quarters because they have court orders that say that these youth have to be separated because maybe they committed common offenses, or maybe they have, maybe they're involved in activities outside or inside the facility that are dangerous to one another. Sometimes we have kids that are relatively aggressive and kind of pick on other kids who are a little more or a little more vulnerable to those types of situations, and we have to separate them. So you need to have some space to separate kids, even if you're not maximizing every single bed every single night. And I do anticipate that we won't be maximizing every bed every night, but we still need to have that space. One of the things that we've been talking about with potential architects is the idea too of being able to have some flexible wall movement in order to move unit size around, right? So for example, most nights we only had, for the past year, we've only had 1 female in the building at a time. Now they integrate for programming, but for sleeping, they're alone. But if you have 1 female at a time and you have, say, a 5-bed female unit, that cuts off a lot of other beds. And if you end up with, say, 14 boys one night, you're in trouble. So we've been talking about how do you, with potential architects, about how do you mitigate and plan for things like that and be able to make an 18-bed facility work for these purposes. Key things in here around, educational space, medical space for the kids, clinical space for the kids, recreational space. This is New Hampshire. We need indoor recreational space because we can't always count on being able to go outside with the kids, and we definitely need to keep these young folks active. If they're not active, you do see that play out in behaviors and other things like that. The last piece of this, the last kind of critical piece of this in terms of the facility itself, is the next section of the bill that talks more around the programming of the facility, kind of moving more towards this trauma-informed treatment, clinically informed programming, and critically situating SYSC within the broader system of care for children. So historically, one of the big troubles with SYSC and probably the prior YDC has been that it's operated kind of on an island, separate and apart from the rest of children's behavioral health. And frankly, there wasn't even a children's behavioral health, as we spoke about last time that I was here. And I think you all had the benefit of a presentation this morning from our colleagues in children's behavioral health. So some of the terms that Representative Edwards spoke about, hopefully were somewhat familiar from that presentation this morning. But really situating this within that so that the kids at SYSC have access to the same exact assessments, the CAT assessments, they have access to the same care management entities so that if they get detained at SYSC, they're then getting the same care management entity, Fast Forward or TREC, to work with them on how to discharge and get them back to the community and keeping them safe in the community, and doing all of that work to really have them be part of that same integrated system so that kids who end up at SYSC end up being part of that broader behavioral health care system to keep them safe and out of a place like SYSC for the long term. And a host of other important things in here around kind of programming and planning and things like that. I'll just pause, and like I said, I don't want to go too deep and too long because you guys have had a lot of that already, and I don't want to waste your time, and just take questions as you have them.
Representative Grossman.
How long is the stay generally for some of the kids that I know it's there's no,
Yep.
but generally how long?
Yeah, it varies depending on the circumstance. So your typical detention, right? So you have detained kids, which are kids who are pending some type of adjudication, right? Many detained kids could be there for as short as a matter of days, meaning like, they're picked up, they've committed some type of offense. After a couple days, a court will decide, you know what, things have cooled down, we're going to let you go home and wait to have, you'll go to court. And that'll get settled later. Other times kids will stay and detained for a few weeks while they're waiting for their court date. Other times, if a child is being charged with a really serious offense and potentially pending adult charges, and that's unusual, we don't see that happen too often in New Hampshire, but something like a murder charge, those young people will stay in detained status potentially for years, right? Because those cases, if they're pending an adult charge, they'll go through a certification process, and a lot of those, there'll be waivers on a lot of those kind of time frames and stuff as they're going through all those processes. So those kids could stay in there for a very, very long time. And they're probably our longest stayers by far. So then the other piece of it is, instead of detained, is committed. Kids who have been adjudicated and they've been sentenced. And the way the laws now read in New Hampshire, for most offenses, it's only a 3-month stay prior to parole. So it's 3 months, and they can actually get out sooner than that if they demonstrate that they're kind of stable and able to kind of step down to another type of program or facility. And we have the authority to do what's called an administrative release at that point. If not, they go to a parole hearing at 3 months, and the parole board makes a decision as to whether they're ready to step down at that point or not. And for more serious offenses, it's typically a 6-month before parole. So what you typically see if you're a committed population is more often a 3-month, but sometimes a 6-month. The really long stayers, like I said, are those really serious offenses pending adult charges, and they're pretty rare, but they do happen.
Any further questions? Representative Bickford.
Thank you, Mr. Chairman. What's it gonna cost to run this thing? What's the finance committee gonna get for a number?
Sure. So as part of the committee that looked at the closure of SYSC about 18 months ago, we provided some estimates around the operational cost of the current facility versus what the estimate of what the costs could be of operating a smaller co-located facility. And it was, savings of around $2 to $3 million a year to do that.
You said savings, right?
Yes.
So, if I may go on, that would be 13,000 down to 11,000, or not thousand, million.
Million.
From
So
13
the
million
current
down to-
SYSC budget, I know people like to say 13 million. The actual current SYSC budget was 10.4 million.
Why they like to do that?
Because that's what it was the last biennium, not the current biennium.
Okay. If I may, okay, when you gave me that number, does that include the bond payments? I assume there's gonna be bond payments.
The bill anticipates that the construction costs will be funded through ARPA, so there would not be bond payments, as I understand it.
Okay, so
One more.
I'm concerned, there's not a lot of significant savings going on here.
I think, a few $1 million a year over potential decades is, I think that's significant, but, that's, I guess, for everybody to.
Thank you.
You could get a new parking garage for the legislature.
Good idea.
Representative Raymond.
Thank you, Chairman, and thank you, Director, for coming and answering our questions. On the question of money, the bill says 15 million to build this facility, and I'm involved in building school facilities right now, and our budget is I don't know, 90, $100 million right now, and we're going to bust it because we can't get what we need. Now, that's for a significantly larger population, but you're going to need a lot of the same high cost items like therapeutic facilities and educational facilities, which have specific building codes and flex space and interior gym facilities. Is $15 million, like, was there a study to come up with that number, or is that like a hopeful number?
So that was, so DHHS did not come up with that estimate. That was an estimate that was provided by Department of Administration or Department of Administrative Services, Public Works, 18 months ago,
Yeah.
when the study committee first came together, right? The study committee that Representative Edwards referenced. The recent fiscal note does have a higher number attached to it. That being said, I think there's a lot of unknowns, right? So, and there's some things that would be different depending on where a facility is located. For example, if we were to build this facility in Manchester at its current site, we would need to build a commercial kitchen. If we were to build this facility next to an existing facility where we could have the food prepared there and brought over, we wouldn't need to build a commercial kitchen, right? There's certain things like that that are going to depend upon where the facility is located that are going to impact the cost of the facility. So there's a lot of unknowns. That being said, construction costs and labor costs have definitely gone up since the original estimate was put out. So I think there are, yes, your point is well taken, and at the same time there are other variables that are unknown.
Thank you. 18 months ago is concerning to me. So thanks.
Are you waving or do you have a question? You have a question. Okay, Representative Grossman.
Thank you, Chairman. I just lost my thought. Do you believe that even though the cost savings may not be this enormous, $3 million, but do you believe that this will be beneficial, not just in dollar amounts, but in emotional health, behavioral health of the population, so that the cost benefit, we will reap rewards from it?
Yeah, I think there's multiple ways to think about it, right? I think one, right, there's just what's the right thing to do for kids, right? And I think from that perspective, there's not even an argument on the other side to be made. From the cost perspective, though, I think there are multiple things. If you want to just talk dollars and cents, in terms of things like, the success rate of keeping kids from, recidivism and ending up in the adult system and being able to actually have productive adult lives. A lot of research says that these correctional modalities of treating kids are not effective. So, why not try something a little more better and a little more effective? And so I think, from a cost perspective, you have that. I think you also have, like I said, the reality of a few $1 million a year every year for a long period of time is, I think, meaningful and will, exceed the cost of the actual building of the new facility in a number of years, as well as the value of the property, whatever ends up being done with that property, which won't be my decision, but is something else that the state has to consider. So.
Thank you. And this concludes the hearing on House Bill 120. For everyone's purpose, we will come back again 3 o'clock next Tuesday. I have to build that into the calendar, so in case we have something to vote on, we will be able to. And perchance next Tuesday we don't have anything new, we'll just declare victory and adjourn at 3:01.